abuse in urban as well as in rural area. And if you will see, injection drug user is a very high risk behavior, which can be seen both the domain, rural and urban. There is a no doubt there is a treatment gap available in this particular area. These are the famous studies has been done in India, for example, substance abuse and addiction research in India, and which shows that alcohol use or abuse prevalence in different regions are varies from 167 out of 1000 to 370 out of 1000. You can see the scenario. A very good meta-analysis by Reddy and Chandrasekhar revealed that overall substance abuse prevalence is 6.9% out of 1000 in India. So these are the shocking data. And this is the combined data which I'm showing that 62.5 million people are using alcohol. This is a recent, very recent data. 8.75 million are using cannabis. As we said, cannabis, alcohol, and opiates are famous consumed drugs by India. Then 0.6 million use sedative or hypnotics. And this is a basic urgent need so that we can tackle this condition here. Majority of individuals were in age group of 15 to 24 years. That's why our target is towards youth population. Our target is that population which is going to become a pillar of the society. Males, definitely no doubt at all, more than 54.4% males are in this particular domain. Majority of sample are illiterate. So where we have to target? We have to target male. We have to target illiterate population. Socioeconomic status are low. Belongs to Hindu families. They are married. Very less comes from joint or extended family. So these are the few indication, few very salient feature we should take care, right? So these are the few indication and where we can give the treatment on the basis of the silent findings. If we compare this urban and rural areas, we have seen that more than 10.7% of population was dependent in rural area at the substance abuse. Alcohol is also very common. Cannabis and nicotine are very common, but in comparison to urban area is less. Multiple drug abuse is very common in urban areas. Now here we have to understand types of drugs. Like most of the people are working in the same field, like they have seen alcohol, they have seen opioids, they have seen ganja, but what is the form of that? That I will try to show you so that it will be very familiar to you people when you are working in this particular field. So three basic categories you have to understand. One is depressant, one is stimulant, and hallucinogens. If we talk about depressant, this is alcohol, opioids, sedative, volatile solvent, and cannabis. Stimulant would be cocaine, amphetamine, tobacco and cannabis. And hallucinogenesis is LSD. This is very common. Nowadays, one new drug came into existence in our Punjab area that is known as ice. Maybe you have heard that name. Ice is known as white sugar. That is very common in Punjab areas. So that also another phenomena which basically we see. These are the alcohol beverages very commonly has been seen by the every people like in hotel, in restaurant, in bar, in family. So these are the few pictorial conditions which I want to share. These are poppy seeds. These are the heroin or smack. Cannabis, very commonly you have seen surrounded of you. Bhang, charas, ganja and hashish is a part of cannabis. This is a Valium or Evil cough syrup. This is very common in university setup. This is very common in college setup. If you will see the university setup, these students basically they used and they're consume. This is very much consumable in stress days. When there is an exam, when they're going to appear in an entrance examination, the consumption will be more. Then we are talking about coca leaf or cocaine powder. This is also very common drugs which basically used by the people. Then amphetamine and types of stimulant basically by the people only. LSD is very common. Sometimes they use in clinical practice also. For example, for pain relief. So they used to take LSD. Volatile solvent is very common. Like for example, if we talk about petroleum, some person used to smell this petrol. Some person used to smell this diesel smell. So these are the volatile solvent part of inhalants. So why do people take drugs? This is a question which comes in our mind. Right. And this is a very major question. If we talk about management part, we should aware about the etiological factor. That is very important. Why a person, healthy person, goes in that particular direction? Why the 15 to 24 year age is very alarming age? Why should we take care of that particular age in a very consideration? And where we should concentrate on that particular age? So there are three major factors which should understand when we talk about the etiological factor. Yes. One is biological, that is genetic predisposition or contribution is very important for drug abuse and addiction. And sometimes this biological factor can overlap with the environmental factor. So here there is two factor which is very important, biological factor and environmental factor. Both plays a significant role in basic substance abuse. Let me give some example for that particular condition. If we talk about mental conditions or psychiatric problem, there are few psychiatric condition which is basically genetic based. For example, we talk about intellectual disability. For example, we talk about autism. Or for example, we talk about ADHD. There is no environmental role, but the basic role is genetic only. But if we talk about substance abuse, there is genetic vulnerability. At the same time, there is a important role of environment. Like for example, we talk about the peer pressure. For example, we talk about the socioeconomic status. That plays a very significant role in this particular domain. Yes. So biological and environmental factor both are very important in this particular domain, and this combination of these two factors plays a significant role. So if we talk about the causes, as we discussed biological, psychological, and social factor, both we have to understand. As I told you, all the management part of drug addiction or substance abuse will lie in these three categories: biological category, psychological category, and social category. So biological category, as we said, genetic factor is very important. If somebody is having family history of substance abuse, there are more chances to be developed in the child. That's why we are saying the biology importance play an important role. The second important factor is biochemical changes. Biochemical changes is basically there are few neurotransmitter which has been exaggerated by the drugs only. Then we talk about psychological factor. If you will see one by one, the sense of inferiority. This is very common in child population. That's why we are saying youth is very predominant, preponderance for this alcohol substance abuse. They are prone for that particular category. Reason being, the sense of inferiority is very much. The poor impulse control, the low self-esteem, desire to escape from the reality, pleasure seeking, and sexual immaturity. There are various reasons. The person who is having low self-esteem, the person who is having inferiority complex, the person who is having other issues in psychological aspect, they have more chances to be developed with substance abuse. Then social factor we are talking about, like religious reason, as we talks about in some part of the India, the opioid or cannabis is very common. They can take as a social, confirmed substance abuse. Then peer pressure is another reason. Then urbanization is another. This has become a social status. When you're going in a bar, when you're going in a party, you have to take drugs. That is urbanization. Unemployment is another social factor which plays a significant role. Then overcrowding and poor social support system plays a significant role in this particular menace. Now we talk about the drug related factor, which is very important. We have not discussing about the psychological, social or biological factor. The availability is a major playing role, which basically plays for abuse and the abuse liability. These two factor, availability and accessibility for substance abuse, basically leads to a problem. So we have to tackle that two factor also in consideration rather than etiological factor as we discuss biological, psychological or social factor, which is very important. Now, these are the terminology we use to use in our clinical setup. For example, use, misuse, abuse, dependence, and addiction. As addiction was very older term, like we nowadays we are not using this term substance addiction or alcohol addiction. We are using alcohol dependence, substance dependence. So these are the few domain which we should understand, right? And in which level we have to give treatment or management that we will discuss. So see, these are the etiological substance abuse. Started with positive attitude, then experimentation, then regular use. Once this regular use will go in next step, that is heavy use or dependency. So these are the two red signs. Heavy use and dependency can lead to any further problem. That can be related to social problem, that can be related to family issues, that can be related to personal issues. We'll discuss. So what do you mean by dependency? Dependence is the factor when somebody is taking drug and that drug has been increased over a longer period of time. His desire is unsuccessful and he's trying to get for longer dose. He's spending too much time. His activities are decreasing as recreational activities is not spending time. He's spending more time to drug abuse. Then he's continuing using when he knows the harmful effect, and the tolerance and withdrawal are there. So these are the dependency. Once patient think that he will come into these six category, he should go for the treatment. Or here we have to intervene the treatment. There are some physical and behavioral signs are there. For example, some parents come to us and their child is taking substance abuse. They don't know. They used to say, sir, we don't know since how many days he's taking substance abuse, but there is some change in his physical activity. There was some change in his behavioral activity. So these are the some warning signs we should be take care. For example, bloodshot eyes. If you see somebody is coming in your home, so your son or daughter is coming to your home and there is bloodshot eyes, you have to give some weightage to substance abuse. Then changes in appetite and sleep. There is another aspect. His sleep would be changed. His sleep pattern would be changed. His weight would be lost. So these are a few physical signs we should be very much take care of this particular substance abuse. At the same time, there is some behavioral sign that is withdrawn behavior. Somebody usually sits in the company or in the group, but nowadays he's staying alone. He's isolated. He's not sitting with the people. So he's declining his performance. For example, if you talk about college performance, school performance, his performance is going to be declined. Financial issues, secretive behavior is developing, sudden changes of friends, and trouble-prone behavior. So these are the few signs and symptoms of drug abuse we should take care. Now there is another relationship issues of substance abuse and mental health. The question arises here why we are discussing these basic issues here in this platform. So substance abuse is okay. Somebody is taking drug, okay, fine. He will be okay, or he won't be okay. He will take drug for the lifelong. But no, this is not only the end of this particular illness. This substance abuse never come alone, or it will come vice versa. For example, substance abuse comes, it comes with the mental health issues. Or somebody attract this mental health problem if somebody is having mental health issue can attract to substance abuse. So these two pillars basically works together, reciprocal. So if somebody is having long-term use of substance abuse can develop anxiety spectrum disorder, or he can develop depression. Very, very common sign of depression is sadness, lethargic activity, loss of interest, no activity at day-to-day life. Then another phenomenon is psychotic illness. We have seen very, very common patients or very, very, nowadays in clinical practice, somebody is taking any LSD or somebody is taking cannabis, suddenly in very abrupt stage, in 1 or 2 days, he is developing psychotic symptom. For example, suspiciousness, for example, fearfulness. These are the very common phenomena. So they can develop anxiety, they can develop depression, they can develop psychotic illness, and lastly, they will land it up into suicide. That's why we are discussing this matter. That's why we are saying that this is a menace of the society and we have to tackle this problem as soon as possible. Nowadays, we are not talking about treatment of the problem. We are talking about prevention of the problem. How to prevent this issue. That's more. Then the another infectious disease as we discuss HIV. The most of the cases of IDU have you seen that will ended up into HIV or AIDS. So these are the very common relationship with mental health issues, substance abuse. Now, these are the component of drug policies. We have to not only discuss management or prevention model, we have to see these three models, which is very important. Prevention, treatment, and rehabilitation. These are the three basic components we should understand. I think I'm audible now. There is no issue. I should continue. Okay, fine. So here, as we discuss, like prevention and treatment model is very, very important. When we talk about the user, substance abuse user, here we have to prevent. If we won't prevent this model, anybody can to convert into harmful use or dependency model. Simple से example मैं आपको देके बताता हूँ. I will discuss in both the languages. Everybody is comfortable, not only English. अगर कोई बच्चा शरारत कर रहा है, if you will won't tackle on the time, if you won't prevent that particular mode issues or activities, he can develop other activities soon. The same thing if somebody is taking use, if he's taking in a society manner, if he's taking in a parties or social circle, we won't tackle that particular prevention model. Then we have to need for the treatment model, which is very, very important. Now there are some barriers which we should understand. Not only city-wise, but if we'll say urban and rural areas, there are few major domain we should understand. For example, why we are not tackling this particular issue due to inadequate funding. That is one policy matter. And we have to understand there is no adequate funding for the substance abuse. Then there is a transportation challenges. Nowadays, we are seeing there is nuclear family, only husband and wife are there, and husband is taking drug abuse. Wife is helpless. Where to take, how to take, where to start treatment. So these are the major issues which we should take care. Then bureaucratic challenges. There are policy issues we should understand. Then lack of integrated in corporation. This is not only one thing which we have to handle. That is, as I told you, accessibility and availability is very another phenomenon. For example, we are treating the patient and he has left that medication. Substance abuse. Suddenly there is availability of substance abuse. He will again take that substance abuse. So this availability and accessibility is a major issues we should take care. Now we are talking about treatment. We have discussed the scenario of the substance abuse. We have discussed about the types of substance abuse. We have seen the ideological factor as biological, psychological, social factor, and how it factor lead to other major issues we have discussed. Now we are talking about the principle of treatment. What we can do in this particular menace. Only do you think if we'll say somebody not to take medication or not to take substance abuse would be enough? No, that won't be enough. जब हम बहुत सारे फैक्टर की बात कर रहे हैं, जब हम बात कर रहे हैं बायोलॉजिकल फैक्टर, व्हेन वी आर टॉकिंग अबाउट साइकोलॉजिकल फैक्टर, then we have to take care of this particular domain. Here we are discussing one by one the principle of treatment. There are few principles you should understand. No single treatment is appropriate for all individuals. We have to use tailor-made technique. Doesn't mean that the same principle will apply to whole population of the world. No, somebody is having different problem, somebody is having different problem, and according to the different problem we have to target. For example, let me give an example for that. Somebody is taking substance abuse and the reason being family discord. That reason is different. Another case, somebody is taking substance abuse due to peer pressure. The reason is different. The another reason is somebody is taking substance abuse, he is going to the social circle or in a party. The reason being different. So all the single treatment measurement will be different. We have to take different management, different appropriate treatment plan for different people. If somebody has a marital discord, familial issues, we have to go different treatment plan. If somebody is taking for peer pressure, different plan. Then treatment needs to be readily available. That is another aspect. The easily we will give treatment, the easily we can handle the problem. The later the will tackle the patient, the later the treatment. The treatment should address multiple needs of the individual, not only drugs. As I told you, this is multifaceted. Not only drug abuse is a problem, there are various other issues are problematic. So we have to deal all the factor one by one. Then individual treatment must be continually assessed and modified as per the changing need. It doesn't mean we are seeing one patient, we are seeing one consultant patient, and this can be only one single domain will be applicable. We have to change that particular domain. Medicine are important, but combined with the counseling and behavioral therapy. Most of the you people are basically belongs to that particular areas. I'm audible. Somebody is messaging. I'm not audible. Is this okay? Yes, fine. So treatment program should address infectious disease to help patient and to tackle the risk behavior. And we have to tackle the mental health issues. Mental health issues mean there are one issue related with, as we discussed, not only substance abuse we are tackling, we have to tackle the mental health issues. That is another important aspect. Now, what is the treatment goal? According to NDTC AIMS 2011 guideline, I'm just discussing with you. The immediate goal will be two: detoxification and intervention of psychosocial and medical crisis. That is one important aspect we should take care. Then the short-term goal, the management of medical modality, psychiatric illness, and reintegration of the patients or with the family. Then we are talking about long-term goal. Just a minute. Let me share my slide again. Yes. Now long-term goal is prevention of relapse, reintegration of the society, occupational rehabilitation, and improvement of overall quality of life. So basically in three tier, we are giving management: immediate, short term, and long term. And these all three tier are very important. And this basically depends on the patient's need. You have to understand. Here the major question comes into consideration: why people do want to change. So this is a cost benefit analysis. We have to show the patient. This cost benefit analysis is very important when we want to see the patient should be changed here. There must be some strategy for that. The most important strategy would be express empathy. See, you have to understand this substance abuse is an illness. As other psychiatric illness are there, substance abuse is also one illness we have to take care of. Then we have to avoid argumentation with the patient, because we are not dealing with normal people. We are dealing with the patient. Then we have to support the self-efficacy. Here, the most important aspect is assessment. Whenever we want to start management, the most important aspect is clinical assessment. Clinical assessment would be in part of different scales are available in your clinical practice. For example, DST, DAST, MUST, ODIT, CAGE, CDAP. So these are the few scales which can give you the frequency, the intensity of substance abuse. And this is very much important. Then stages of changes. The foremost important question for substance abuse is motivation. Whether patient is motivated to leave this substance or not, that is important question. So these 5 stages of change are very important. For example, in pre-contemplation, patient doesn't know or he's not believing that he should leave the drugs, or there is no need to change the drugs. Then there would be contemplation, where patient can realize, yes, I'm taking my drug, but I have to think about that. Then there will be determination. Yes, I want to leave this drug. Then action. You will admit in a hospital, then maintenance, and then relapse. So these are the few aspects which we should concentrate. Contemplation stage, determination, action, maintenance, and relapse. So these are the few aspects we should take care. How to deal these 5 aspects? For example, if we talk about motivational enhancement therapy, if somebody is in pre-contemplation stage, the patient don't want to leave the drug, he's comfortable with drug abuse behavior. So here we have to motivate his status and we have to come to that particular problem. This is a systematic intervention is very much important. Motivational in psychology is very important. We have to motivate the client or patient. Then another very important aspect is relapse prevention. Somebody is taking medication, he has left that substance abuse or medication, whatever he is taking, harmful use of medication, then yes, anytime he can come into category of relapse prevention. So relapse prevention is very important aspect which basically can come in our domain only. See, you just remember one thing. The absence, or we can say the removal of substance abuse is not a major task, but consistency and continuity is very important task. In substance abuse, that is the only issue. The patient comes again and again with relapse. He will leave this drug for 1 year, 2 years, 3 years, then again he will relapse. Again he will come in the same condition. So that is relapse prevention. And basically relapse prevention is important, and we have to give 3 important psychological management. For example, skill training. This is very important. Or we have to setting the goal. That is very important. So coping skill ट्रेनिंग, बिल्डिंग सेल्फ स्टीम एंड लाइफस्टाइल मॉडिफिकेशन, इसमें आप देखिए सारी चीजें बेसिकली डिपेंड अपॉन साइकोलॉजिकल फैक्टर एंड जो भी पर्सनैलिटी के इश्यूज हैं उसको हमें टैकल करना है. सो साइकोलॉजिकल एंड पर्सनैलिटी फैक्टर आर इंपॉर्टेंट इन दिस पर्टिकुलर डोमेन. कोई भी एक पर्टिकुलर डायमेंशन, कोई भी एक पर्टिकुलर मैनेजमेंट इज नॉट हेल्पफुल. दैट्स व्हाई आई एम सेइंग वी हैव टू टारगेट दिस 3 बेसिक डोमेन एंड ऑलवेज जो आपका मैनेजमेंट पार्ट होगा दैट विल कम इन ए पैकेज. That management is not only giving one direction. For example, हम सिर्फ फैमिली को ट्रीट कर रहे हैं. For example, हम सिर्फ पेशेंट को ट्रीट करने की कोशिश कर रहे हैं. That won't be really helpful. So here, when we talk about relapse factor, we have to give more importance to personality factor and individuals factor. That is more important. So self-efficacy and outcome expectancy is very much important in relapse prevention. That we will discuss in detail if somebody want to know about this particular factor. Then attribution of causality. There are 2 major aspects. For example, locus of control. If we are talking about locus of control, somebody is saying I am taking drugs because of my family issue. तो मेजर फैक्टर होते हैं जो आपको ध्यान रखना है, इंटरनल लोकस ऑफ कंट्रोल एंड एक्सटर्नल लोकस ऑफ कंट्रोल. Internal locus of control means I am taking my drugs because I am taking my drugs. I am responsible for that. I'm the main culprit for that. Internal locus of control. External, because I'm taking drugs because of my family issues. I'm taking my drugs because of financial issues. ये जो दो major issues हैं, that you have to take care. So we have to see the attribution of causality. That is very important. Then decision making process. We have to help to decision making process of the individual. Then another important aspect is cognitive behavior therapy. This is a psychological treatment method which basically give the basic idea on the feeling and thought. Why patient is taking substance abuse? Maybe his situation is not good. Maybe his thought is very negative. Maybe he's taking circumstances as he can't deal the situation. So here the cognitive behavior therapy is very important so that we can change his cognition as well as his behavior, and which plays a significant important role to change his particular behavior. Few major components of CBT would be skill training, problem solving ability, assertiveness, interpersonal skill, and enhanced social support. So if we target these four support, problem solving abilities, assertiveness training, interpersonal skill, and social support can be enhanced. The more than 70% problem he can tackle. For example, we talks about the assertiveness training. What is assertiveness? If you want to say no, if you don't say no, that is a problematic. मेजर प्रॉब्लम कब आता है? एक इंसान, एक इंडिविजुअल, एक क्लाइंट जब शराब या अल्कोहल छोड़ के जाता है, जब वो ग्रुप में बैठता है, पीयर प्रेशर वुड से यार टेक वन पैग मोर, and he is unable to say no. That is assertiveness. So here assertiveness is very important to deal with this particular domain. Then this is a brief intervention that is known as frame: feedback, responsibility, advice, menu of option, empathy, and self-efficacy. So this brief intervention is very important for substance abuse. Like the first of the important part, we have to do the feedback. We'll take feedback from the patient, like how you are feeling after substance abuse. What is your feedback? You are taking substance since last 5 years. What is your feedback about that particular domain? Then we have to give the responsibility. Who is responsible for that current situation? Then we have to give advice. Then we have to give menu of option. Then empathy and self-efficacy. So it's a brief intervention plan we can give. The another aspect is family therapy. Family therapy is another aspect which is very important for substance abuse. Self-help group is very important, as we discussed: alcohol anonymous group, narcotic anonymous group, and cocaine anonymous group. Nowadays they are doing very good because they are related with spirituality, with philosophy, and they are doing wonder for that particular condition. Another important is network therapy, that is known as therapeutic community, which basically you are working in NGOs, which you are working in a working condition. So this is a network therapy, which is very important. So here we will conclude this all the domain, like substance abuse has been challenge for health professionals. There is no doubt at all. Pharmacological and psychosocial approach to the management of alcohol drug abuse tend to go hand by hand. They are complementary to each other, and best result would basically we feel when both the treatment plan, that pharmacological and pharmacological, will go hand by hand. Psychosocial intervention provide individual an opportunity to explore, discover, and clarify ways to live more resourcefully. Nowadays, he is taking drugs, but is not aware about this particular resourceful, which is available surrounded to him. So we have to give that this one insight and with a greater sense of well-being. So there are the few recommendations and take-home messages for today's session. One is scientific evidence-based treatment need to be more available for people with substance abuse disorder. The evidence-based substance use prevention program should be available. A conducive legal and policy environment is needed to help and to control drug control problems. So overall, these three basic, if we talk about government policies, if we talk about individual factor and social factor or society factor, are very important factors, which basically can give some insight or some result in this particular domain. Otherwise, the problem will be, you can understand. So with this presentation, I will thank you for the participant for patience learning and listening. Thank you very much.
Now I'll request all the participants to please you can clarify your doubts or you can ask some of the question to our honorable speakers.
Hello.
Unmute yourself.
Hello.
Yes, I can hear you.
Hello, I am not audible. You are not audible to me.
Sir, I exactly don't know.
Hello.
Hello, good morning, everyone.
Yeah.
Actually, can we get these materials
Who is speaking? Like, can you give me your bit introduction, sir? Then I will tell you the whole process.
I'm a Keshav. My name is Keshav Lamsal. I'm from Meghalaya, Shillong.
Okay. Okay.
I'm
Sure,
a
sir. We can share the materials, sir. Okay. Fine. Fine.
No, session was very good and informative. But if you can give us this network.
Definitely, sir. I will share my email ID to Dr. BK Sharma, sir. He will share with you people. है ना? I will share my whole detail with Sharma, sir. And he will just send you my mail ID. Just give me a mail. I will revert back to you. No issue, sir. That I can do.
I'll just put my mail address in the box.
Sure, sir. Rather than I should put my mail address because I'm unable to write down. You just give me a mail, then I will send you.
Okay.
Good morning, sir.
Good morning.
Krishan Soni, sir. The session is very excellent. I joined in the last 20 minutes. Even though basically I'm a psychologist from Andhra Pradesh, Vijayawada. I'm working for awareness programs, creating awareness programs in colleges and schools on behalf of Nasha Mukta Bharat.
Sir.
And on police department task force, I typed with police department and had excellent knowledge from your session. Can I have a recorded session for this, what you conducted now? Is it available or can you share that slideshow?
Yeah, definitely, sir. I will share. Just send me mail ID. I have already put my mail ID to chat box. Just send me mail, then I will revert back to you. No issue, sir. I will send you my detail also.
And this session is guided by Dr. Anand, sir. So thanks to Anand, sir. Thank you very much.
Good morning, sir.
Good morning.
Am I audible?
Yeah, you are audible. Please. Shraddha.
The session was really very good. Sir, I have a question. As we know, all addicted patients started consuming cannabis or tobacco in their school days. So my question is, which are the target group for us, youth and school-going child or teenagers?
Basically, I will give you one very good example here, Shraddha. We were doing some study in college and universities here in Chandigarh and Punjab, in Tri-City only. So there's two major things which I want to discuss with you. For example, if we target school population, right? The system that their condition would be different. If you're going in a youth and adolescent group, the condition would be different. But if you're going in a school population, you just try to understand few behavioral issues, which is very important. For example, you can assess through CBCL or you can assess through CPMS. These are the few scale are available. Through that, you can assess the behavioral issues which the child is having. And you can predict if somebody is having these behavioral issues, he can develop substance abuse in future. That is very interesting finding which you have seen. And if you are going in adolescent group, you see, as we discussed, few personality traits, for example, inferiority, low self-esteem, depression, isolation. These are the few factors which is known as pride of personality or darkness of personality. These people are very much, inclined or prone for substance abuse. So these factors are very important. Recently, we did one study in internet addiction and substance abuse correlation with this particular two domain. We have seen the person who is more dependent on an internet addiction, more than 8 to 9 hours they are searching or they are surfing for internet, they are more prone for substance abuse. So these are the few important domain you should understand. And I'm telling you, if you will apply this scale, you will get a very good result. And we'll share that scale and that finding with you so that you can understand the particular mindset of school population and adolescent group. That's why we are starting some program that is known as school mental health program, which is very important in this particular session only, right?
Thank you, sir.
But I'm very, happy and lucky you people are very interested and enthusiastic in this particular field. And I hope you are doing wonder in NGOs and, whatever substance abuse or drug addiction center you are working. Very good. I'm happy you are. Any problematic issues which you have seen in your clinical practice, in your NGOs, like nowadays we are seeing so many other issues. For example, substance abuse, plus you have seen the scenario. Nowadays you are not talking about suicide. For example, very recent cases of Shraddha. very recent cases of so many other, state you have seen. Now we are talking about the mass killing, mass suicide that is very much prominent and towards substance abuse. So there are very, lethal outcomes basically we see in substance abuse, very lethal outcome. The whole family used to go for mass suicide, and the reason being substance abuse, reason being alcohol addiction, right? So these are the very, very lethal issues which we should take care.
Dr. Krishna, my
Yes.
name is Achu.
Sure.
I'm from SLCA, Haryana. So, I was wanting to know how is that you can identify a mask the addict wears? What are the tools you
Sir,
would use, whether he
yes,
is genuinely interested in recovery or is he masking?
right. Sir, there is two major phenomena. Like I should give the more, comprehensive statement over there. The major important issue is personality. See, in substance abuse, in drug addiction cases, you have seen most of the people are manipulative because of their personality issues. That's why the outcome is not very good. You are dealing so many relapsed patients in day-to-day life because of their manipulativeness, because of their locus of control. So here the most important thing is personality. You have to assess the personality in a very clarified manner. For example, few scales are available through that we can assess whether the patient is genuinely want to leave drug or not. One thing. The second important aspect, the related issues. For example, if you can talk to the family member, if you can talk to the parents, or if you can talk to the wife or husband, you will find out the personality in a very good manner. Like they will give you a better result whether he want to live or not. Most of the patient will come in pre-contamination stage. Sir, very less patient will come when they want to leave these drugs. When they are coming in a pre-contamination stage, they are saying there is no problem at all. The problem is to the society, to the family. I'm happy with my drugs. On that particular time, your role is to improve his motivation, to improve that motivation through pre-contemplation to action stage, the time when he can come to you. Because most of the time he don't have that information that what effect it will give to your life. What is the outcome of that particular drug? So personality is one, another is familial issues, and few scales are available through that we can assess the genuineness of the patients. Yes. And the major role is R. We have to motivate the patient, not only starting of the treatment, but yes, relapse. That is another aspect. We should take care, sir.
Thank you, sir.
Hello.
Ji.
Good afternoon, sir. I am G. Shrikali from Visakhapatnam, SEED IRCA.
Yes,
Sir,
please.
am I audible, sir?
Yes, ma'am. Yes, ma'am. Please.
Okay. Here we have got two cases, sir. Age 13 years. They are addicted to gums, where it uses in carpenter work.
Yes, yes.
So the two children, we have already got the cases from police department that some of the children are addicted to these guns. Is there any technical methods
Yes.
from where we can get rid of it?
Yes, yes. Basically, for example, if we talk, this is comes in a category of substance dependence.
You have told us volatile. Yes, sir.
Solvent volatile. This is the same condition.
Yes,
Let me give one case example to you people. है In our PJ, there is one CP meeting is there. CP meeting is a clinical presentation meeting. And one patient came to us and he came with the problem of depression plus some physical issues. Right? And there was no other reason. We could not find out any reason for that particular behavioral issues. That deterioration in his memory, the deterioration in his attention and concentration. Then we came to know. Then we came to know he was working in a paint factory. And in paint factory, he was just smelling that thinner. So that all the issues has been came out like depression. On that particular time, we have to admit that patient. We have to give the psychoeducation is very important. See, in substance abuse and mental health conditions.
తెలుగు వాళ్ళు ఎవరో ఆడియో ఓపెన్ ఉంది తెలుగు వాళ్ళు ఆడియో తెలుగు వాళ్ళు ఆడియో క్లోజ్ చేయండి తెలుగు వాళ్ళు ఎవరో మాట్లాడుతున్నారు ఆడియో క్లోజ్ చేయండి ప్లీజ్ తెలుగు వాళ్ళు ఆడియో క్లోజ్ చేయండి ప్లీజ్
Can I speak?
Sir, please continue, sir. Please continue, sir.
Okay. So, in this particular domain, the most important thing, as I told you, the empathy and psychoeducation is very important. If you are giving psychoeducation to the patient, I'm sure I am giving you very much clear instruction. If you are giving very good psychoeducation to the patient, 20-30% he will feeling relief. For example, one patient came to us with OCD, obsessive compulsive disorder, and that girl told us, "Sir, I want to die." She's a 16-year-old girl. She said, "Something is happening with my thought. I'm thinking I'm different from other girls, and I want to make suicide." Then we have explained her that this is OCD. OCD can be improved. OCD can be treatable or recoverable. You can believe 50% patient was relieved. She was saying, "Okay, my God, this is a problem. I can be okay with that problem. Then I will try my best." So do you think psychoeducation is very important aspect, and psychoeducation is based on your personality profile? As such, the therapist empathy is very important, right? In next time we will share how to deal that patient, like personality issue, therapeutic alliance, familial education. That we will discuss in some session, like how to make that therapeutic alliance should be very better manner. That we will discuss in some session, because today's time won't allow us. Otherwise, I will tell you what personality factor are important, how to deal with personality factor.
Also, he is neglecting his studies and discontinuing 7th class.
Definitely.
This is the problem.
Same as I told you, if you will see the trait of personality, that is more important. The personality
Yes,
factor
sir.
are very important factor. Here we have to target
Yes.
that personality domain, right?
Sure, sir. I will
Yeah.
deal with that.
Yeah.
Thank you very much.
And whenever you feel any help from our side, from clinical work, from PJ Chandigarh, I'm always available. You people can share any case history, case experience, and we can try to help you better.
Sure,
Sir,
sir.
sir, good
You-
morning, sir.
Thank you.
Good morning.
So this is Vani, and I'm from Vizag. I'm a counseling psychologist. The case what you discussed about that the person who is 13 years old, the addicted for that such kind of inherence, the basic background of the social environment and the family background is too much poor, sir. There actually I attended that case. What she has already told. I'm a consultant over there. So I try to communicate with the people. I try to change the personality because there is a so many kind of factors over there. The parenting, low social economic, poor parenting basically. Poor parenting, even though when I explain each and everything to the mother is not at all taking care of about the child, and the child has very kind of there is no any kind of social responsibility, family responsibility. There is so much of personality. I'm not sure about that. How much of psychoeducation and behavioral changes what we need, what we tried from our end, being a psychologist. But I felt that there is no any kind of changes in that person. Though it is a 13 years old boy, he was matured in some kind of social anti activities. He was inspired by the society, by
Yes.
seeing the seniors and the inspiration by the movies and everything. He know how to survive. He know what he do, like such. He was not at all interested on the studies. So there is so much, because the basics, the where he was grown up, that we cannot change it at all, sir.
Vani,
Once, yes, sir.
let me give put some light over there. See,
Yeah, yeah,
because you are related with this field, only related with this particular case, you are seeing that case. There is three conditions which you should understand. See,
yeah.
one is ADHD, you know, attention deficit hyperactive disorder.
Yes, sir.
If we won't
Yeah.
tackle that ADHD, that will convert into ODD, oppositional deficit disorder. If you will
Yes, sir.
won't convert this ODD or won't control this ODD, that will convert into CDD. If you won't control that CDD, it can convert into ASPD, antisocial personality disorder. The most of the cases which in police department we are seeing. So
Yes.
somehow we have to give that prevention model. We have to apply that prevention model on that particular age. And that prevention model is not only one domain based, not only biological based. Yes, psychology plays a very significant role. I'm telling you, if you are sit with that particular child, we are not talking about biological factor, we are not talking about psychological factor, but if you are giving that hinge where the problem is occur. For example, very famous theory which is known as down drift theory. Maybe you have heard about that. For example, somebody is taking substance abuse. Now there is economical issues. He will go in a poor stage. Then that poor stage can lead to substance abuse. That vicious circle will start. So here, social factor you have to take care, and the psychological factor. Like I'm talking why? Because the personality is very important, and this is a very good age where you can tap. Otherwise, I'm telling you, after 5 years, he will convert into ASPD, anti-social personality disorder. So that domain you have to understand, personality profiling is very important. and you just try to profile that personality, and then you will target that personality issues. If there is any cluster A personality trait or cluster B or cluster C, you just take care of that trait. Accordingly, you just make DBT or CBT, whatever feel comfortable, you just try to give. Otherwise, the problematic behavior will leading to some other diagnosis.
Mm. Okay. Yeah, case.
Thank you.
Hello. Hello.
Ji.
Sir, good morning.
Good morning, sir.
My name is Mohammed Sirajuddin.
Sir.
Hello.
Sir, I'm hearing you, sir. Please tell me.
तेलंगाना ARC चेयुता से बात कर रहा हूँ सर, काउंसलर में।
जी।
जी सर, ये अब अल्कोहलिक अब्यूज काउंसलिंग सेशन में अल्कोहलिक अब्यूज प्लस कैनबिस अब गांजा पीने वाले को मिला के हमें काउंसलिंग दे सकते हैं क्या?
बिल्कुल दे सकते हैं, इसको मल्टीपल सब्सटेंस अब्यूज बोलते हैं, दोनों को मिला के दे सकते हैं, बट सी द सीवियरिटी एंड सी द इनसाइट, दैट इज मोर इंपॉर्टेंट. Two group, you should take homogeneous group, don't take heterogeneous group, right? So that you should take care, otherwise you can give no issue.
ये क्वेश्चन का ही पूछ, ये कैनबिस बोलने वाले का बिहेवियर अलग है, वो लोग तो बहुत झूठ बोलते हैं, अल्कोहलिक वाले का थोड़ा अब हम बोल तो समझते हैं सर, वो इंडिविजुअल ज्यादा देना पड़ता है उनको, फिर भी रिलैप्स होने के चांसेस कैनबिस वाले का ज्यादा है सर, वो सब झूठ बोल रहे हो सर.
नहीं, मैं देखो इसको ना बड़ा इंपॉर्टेंटली मैं आपसे डिस्कस करूंगा कि दोनों में पर्सनालिटी ट्रेट ज्यादा डिफरेंस नहीं होता है ना. That is different aspect. Somebody is going toward alcohol, somebody is going to cannabis or opiates. The major issue is see the severity. If somebody is having more severe issues, then try to give different group. But if you think the both are motivating each other, then you can take a homogeneous.
Yes, sir.
That you should take care. But sometimes group therapy is very important in this particular domain.
बेशक सर, बेशक ग्रुप थेरेपी में वो लोग पर्सनल बिहेवियर बहुत तक ओपन होता है सर उनको. मेजर में वो लोग एक्सपोज होते रहते हैं फिर भी.
लेकिन ग्रुप बनाने से पहले आपको यू शुड बी वेरी मच केयरफुल, उसका थोड़ा ध्यान रखना. उसकी एक गाइडलाइन है, sometime we'll discuss with you. That is very useful guideline for group therapy. We'll discuss sometime, right?
जी सर. ग्रुप थेरेपी को ज्यादा हमें वो ट्रेनिंग चाहिए सर हमको. ग्रुप थेरेपी में ये होता ज्यादा तक वो लोग हमको बोला पर्सनल बिहेवियर ओपन होते रहते ना, तो सब झूठ बोलते रहते ना सर वो लोग. हमें सच में हमारे फैमिली वाले हमारे सपोर्ट नहीं कर रहे, हमें असल कुछ भी नहीं कर रहे, हमें सब भी बोलते रहते ना सर.
डेफिनेटली.
उसलिए ग्रुप थेरेपी को थोड़ा हमको एक सेशन
we'll discuss surely we'll discuss. मैं आपको सारा बता दूंगा उसका सारा.
थैंक यू सर. थैंक यू.
गुड मॉर्निंग सर.
हेलो जी.
हेलो.
I can hear you. Yes, Anuradha.
Yes, sir. My name is Anuradha and मैं यहाँ SPYMD एडिक्शन सेंटर वसंत कुंज में काउंसलर हूँ. सर मेरा एक क्वेश्चन है कि जब मैं सेशन के लिए जाती हूँ तो कुछ क्लाइंट्स हैं वो हमेशा ही बोलते हैं कि मैम नशा ऐसी बीमारी है कि ये नहीं छूट सकती जीवन में कभी भी. हाँ, उनका एक बिलीव है ऐसा कि हम इससे कभी भी बाहर नहीं निकल सकते हैं. कुछ टाइम के लिए रिकवरी बनाने की कोशिश करते हैं, बट ये मतलब लाइलाज बीमारी है. बट एक्चुअली मैं उनको हर वक्त एक्सप्लेन करती हूँ सर कि नशा एक लाइलाज बीमारी नहीं है, बिकॉज कि नशे से सबसे ज़्यादा आपके जो आपका पर्सनालिटी डिफेक्ट्स हैं या जो आपका मेंटल हेल्थ है वो डाउन होता है. ठीक है, आपकी व्यवहारिक बीमारियां हैं ये. तो व्यवहारिक बीमारियां तो सर मैं ये जानना चाहती हूँ कि ये तो हम ठीक कर सकते हैं ना सर? व्यवहारिक बीमारियां तो ठीक हो सकती है ना?
देखिए जो व्यवहारिक बीमारी है उसको, जैसे कि मैं आपको कुछ और दूसरी बताता हूँ जिसको बिहेवियरल एडिक्शन बोलते हैं, इससे अलग होता है. जैसे फॉर एग्जांपल इंटरनेट एडिक्शन, दैट इज बिहेवियरल एडिक्शन. देन वी आर टॉकिंग अबाउट पैथोलॉजिकल गैम्बलिंग, देन सेक्सुअल एडिक्शन, इसको बोलते हैं बिहेवियरल एडिक्शन. जो कोर सब्सटेंस अब्यूज है दैट विल कम इनटू कैटेगरी टू सब्सटेंस अब्यूज कैटेगरी ओनली, राइट? दैट इज नॉट बिहेवियरल इश्यूज, बट यस बिहेवियरल इन्वॉल्वमेंट आर देयर. सो इसको हम ठीक कर सकते हैं, देयर इज नो डाउट एट ऑल. लेकिन अनुराधा, मैंने जैसे बोला ना कि इसको मल्टी
काम में डालने वाला है ना,
बहुत सारी चीजें जो आपको ध्यान देनी पड़ेगी. आपको उसका जो बेसिक इश्यूज है वो
Can't hear anything.
हेलो
सर आप म्यूट हो गए सर।
हेलो आवाज
सोनी
आ
सर
रहा है?
आप म्यूट हो गए, आप म्यूट हो गए।
तो ये जो बेसिक जो चीजें मैंने जैसा बताया कि ये बिहेवियरल इशू तो है ही है। जैसे बिहेवियरल एडिक्शन की बात करते हैं तो उसमें इंटरनेट एडिक्शन, पैथोलॉजिकल गैम्बलिंग, सेक्सुअल एडिक्शन, वो बेसिक होते हैं बिहेवियरल एडिक्शन। सब्सटेंस अब्यूज एडिक्शन में जो बहुत सारे मेजर एस्पेक्ट हैं, जैसे मैंने बोला पर्सनल एस्पेक्ट, फैमिलियल एस्पेक्ट, सोशल एस्पेक्ट, उसको अगर हम टारगेट करेंगे देन आई थिंक यू विल बी सक्सेसफुल इन दिस पर्टिकुलर
ओके
मैनेजमेंट।
बट सर इनका जो एक बिलीफ इनके जो बना होता है कि नशा कभी भी छूट नहीं सकता, या फिर जो भी रिकवरी मेंबर्स भी आते हैं उनके सेशंस के लिए जीएफटी वगैरह कुछ भी होती है, तो उनका उनका एक बिलीव है सर कि हम नशेबाज हैं तो हम इससे कभी भी
अनुराधा
नहीं।
यहाँ पे तो हमारा रोल शुरू होता है ना।
यस
अगर
सर।
वो यही सोच लेंगे तो फिर हमारे पास आएंगे ही नहीं। हमको कुछ रोल मॉडल दिखाने पड़ेंगे उनको, सी दिस इज द रोल मॉडल।
यस
अगर
सर।
हमें हनी सिंह ने नशा छोड़ा तो इज ओके नाउ। हनी सिंह भी नशा करता था, दीपिका पादुकोण को भी डिप्रेशन हुआ था, उन्होंने बताया मीडिया में आके कि मेरे को डिप्रेशन हुआ था, आई एम ओके। दीज आर रोल मॉडल विच प्लेज एन वेरी सिग्निफिकेंट रोल। इसलिए मैं बोलता हूँ आजकल मीडिया का रोल बड़ा है। अगर आप देखो नेटफ्लिक्स, प्राइम वीडियो, द मैक्सिमम कंटेंट क्या है, साइकेट्री कंटेंट है, मेंटल इलनेस है, दैट इज गिविंग अवेयरनेस। दैट अवेयरनेस इज वेरी इंपॉर्टेंट फॉर अस।
यस
So
थैंक
that
यू
is
सर।
useful content. जी
थैंक यू सर।
Hello, sir.
जी
Hello, sir.
जी
हेलो
Sir, I'm Shraddha from Jagran Patna. So my question is, which therapy we should apply of multiple drug use patients and clients? CBT or
मल्टीपल
MBT, multiple drug use.
सीबीटी इज वेरी यूजफुल। अगर कहीं फैमिली थेरेपी की जरूरत पड़े तो वो भी अप्लाई कर सकते हैं आप। यस
हेलो
जी सर।
sir, my question is, when the drug user or drug abuser, drug addict, the patient not willing to
ये
come to take a counseling session or a treatment or therapy, the family members, usually it is happening in my practice, sir. The family members will come and my husband is daily drinking, he is not willing to come to take a session or a therapy. Then what we have to do, sir, in that cases, in that particular cases? The patient is not willing and he is not interested to come and change himself. You got it, sir? Hello?
I got it, sir. The
Yeah,
most
yeah.
of the cases in drug addiction happen the same thing because of insight. And when there is no insight, this will become more difficult to treat. You know, that's why drug addiction is a substance abuse, a chronic mental health issues, chronic substance issues for psychiatric issues. So first we have to develop the insight. Insight is very important, sir. Without insight, he won't come to you for treatment.
How can we create insight with the patient who won't come to clinic now, sir?
Sir, basically there is two methods which basically we use here.
Yeah.
One thing, the proxy is very important. For example, you just try to understand the scenario of his personality, like what he is doing at home, what is the current scenario at their home, what he is doing, what is the habit and interest, how he is spending more time in his day-to-day activities. There must be some psychological issues, for example, depression or anxiety or some mental health issues or psychological issues. You have to target that first. The substance abuse would be secondary to him. You just give information to the family member how to tackle this particular issue.
Information to the family member.
Yeah. That is more important, sir. So once you will tackle that person,
Basically, the lack of motivation, sir. Here,
definitely, sir.
the thing is lack of motivation to the family member or to the abuser. Most of the cases we got is these alcoholics, sir.
Yes. In alcohol, lack of motivation, that same thing, pre-contemplation stage. They think this is not a problem.
Pre-contemplation stage, yes.
I'm happy with my issues. I don't have
Yes.
any problem. The
Yeah.
same thing, the symptom is good, is
For my
syntonic.
pleasure, I'm taking. I'm not addicted. I'm not
Definitely.
addicted. For my pleasure, I'm taking. I won't come there. Like
Yeah.
that, the family members are complaining about the alcoholics.
No, if this is severe cases, sometimes we have to register patient and we have to forcefully admit that patient. That is another aspect which I should not discuss here. But if
Yeah.
somebody is having severe issues, somebody is having severe psychiatric illness, psychotic illness with substance
Forcefully we
abuse,
can admit. If it is not a severe issue, or the patient does
we
not
can't
have
do
any
it.
severe
Yes. Problem.
other problems, other medical problems.
Yes.
Only is the drinker, daily drinker,
Yes.
or daily is a ganja or marijuana addicted.
But
So
there,
he doesn't have any serious
Issues.
issues.
Yes, yes, yes.
Even though he is not interested to come here,
Yes.
then in that case, what we have to do, sir?
See, basically, we have to, major issue is family member. We have to discuss the family member and we'll try
Family
to
member.
motivate if possible.
Yes.
That is
The
indirect.
patient father or patient mother or
Yes.
patient wife, or they will come and
Definitely.
approach us.
Yes.
Yes, sir. Yes, sir. Yes, sir.
So on that particular time, we have to give more intervention, more psychoeducation to the family members so that once they will motivate at home how to deal with that particular issue. Because there must be some frustration, there must be some argument.
Family therapy. Again, we have to use the family therapy and
Yes.
motivation to the family
Yes.
members.
Yes, yes.
So that they will convey our motivation class
Yes.
to the patient.
True, sir. True.
Okay. Okay, sir. Thank you very much, sir.
Thank you, sir.
Actually, sir,
Ji.
can we admit the person without his consent?
Yes, sir, we can. Now a Mental Health Care Act also saying without consent also if problematic behavior is there with or without consent we can admit if the problem is severe.
We will have to take the consent of the at least the
Family
guardian.
members.
Is there
Yes.
sir, is there any parameters for severe term? The term you used severe, na?
Yes.
Is there any parameters to calculate this severe or
Yes, sir.
moderate?
Yes, sir. For example, yes, there is if socio-occupational disturbance is too much. For example, patient suicidal, that is severe. If patient is having hallucination, delusion, or suspiciousness, fearfulness, that is a severe condition. There is a very famous case you heard about that Lucknow or somewhere else. The mother and daughter was in room for 1 month. They were closed there.
Yes, sir. Correct.
No, this is a severe case, sir.
Before last year, I think, sir.
Yes, sir. Yes, yes, yes.
Sir, one more, sir. Can you share these scales? The DAS I have.
Yes, sir. DAS is for anxiety, depression, and stress.
Anxiety, depression, that is okay. Stress. What I requested is for alcohols and substance use.
Assist you can use. Assist and must is very useful, sir. Assist I will share with you.
Yeah, sir. Sir, already I
Definitely, sir.
sent my mail ID, sir. Can you please share? It is very helpful to our regular practice. I'm from NGO Akarsha Foundation.
Sir, I have sent my mail on this chat box, sir. Just give me a mail. I will definitely send you. No issues.
Yeah, just now in chat box I gave my mail, sir.
Sir, I couldn't note it down, but you can send me mail. That will be easy for me.
Okay, sir. Sir, can you share your mail, sir? I'll note it down.
Yeah.
Please.
Hello.
Sir.
Yes.
Good morning, sir.
Hi. Sir, tell me mail ID, sir. Hello.
Yes, sir.
Sir, please share your mail ID.
Sir, I already did, sir.
Okay. I'll check, sir.
Hello, good morning, sir.
1 minute.
Sir, can you guide how to deal with brown sugar patient?
See, the same method will applicable, ma'am. Any addiction, if you will take alcohol, substance abuse, opioid, or cannabis, or brown sugar, the method would be same only. You know.
Sir, method same है, but बहुत difficult होता है, sir. उनको जी.
I know. See, sir, हमेशा एक चीज का पुष्पा जी ध्यान रखना, जब भी हम सब्सटेंस अब्यूज के ट्रीटमेंट की बात कर रहे हैं ना, डायरेक्टली यू शुड नॉट टारगेट ओनली सब्सटेंस अब्यूज. मैं एक बात को हमेशा बार-बार बोल रहा हूँ, जब हम प्रिंसिपल ऑफ ट्रीटमेंट की बात करते हैं तो उसके पेरिफेरी की जो इश्यूज हैं, जो उसके आसपास के जो इश्यूज हैं, उनको सबसे पहले डील करना है आपको. आपको इन डेप्थ जाने के लिए, सेंटर में जाने के लिए पेरिफेरी को तोड़ना जरूरी है. वो पेरिफेरी इश्यूज को जब आप टैकल करेंगे, फॉर एग्जांपल जो भी इश्यूज हैं, है ना, ब्राउन शुगर ऐसे तो नहीं लेता, देयर मस्ट बी सम ईटियोलॉजिकल फैक्टर. उस ईटियोलॉजी को जब आप ध्यान रखोगे तो it will be more helpful to go into depth and you can give better management to that particular case. आप उसको डिटेल में मेरे से शेयर कर लेना. जहाँ पे भी मुझे लगा I can help you out, definitely I will help you out.
Okay, sir. Thanks a lot, sir.
जी मैम.
Good morning.
Good morning जी.
सर, मल्टीपल जो एडिक्ट पर्सन होते हैं एज ए लाइक अल्कोहल, अफीम, ओपिएट वगैरह जो भी इस्तेमाल करते हैं सर, ये इनकी लॉन्ग टाइम से, बचपन से बच्चों को लत, या कोई भी पर्सन होता है छोटा बड़ा, लत होती है लेने की, तो सर क्या चांसेस होते हैं कि जैसे अपनी मैरिज लाइफ में आने के बाद उनके द्वारा जो बॉर्न बेबी होता है उसको कोई मेंटली या फिजिकली प्रॉब्लम क्रिएट हो सकती है क्या सर?
सर इसमें ना एक वो तो आता है अल्कोहल सिंड्रोम, जो मदर को अगर अल्कोहल ले रहे हैं तो बहुत चांसेस है कि बच्चे में प्रॉब्लम आने के चांसेस बढ़ जाते हैं। लेकिन मेल्स में क्या होता है सर, जैसे कि फिजिकल इश्यूज हो जाते हैं। फॉर एग्जांपल अगर एक रेगुलर टाइम से आप अल्कोहल या कैनबिस ले रहे हैं तो स्पर्म काउंट कम हो जाते हैं, इनफर्टिलिटी के इश्यूज आ जाते हैं, बड़ी कॉमन है सर। उसके अलावा सेक्सुअल इश्यूज हो जाते हैं, क्योंकि मैरिटल लाइफ के दो मेजर कंडीशन है सर, एक सेक्सुअल लाइफ और दूसरा इमोशनल लाइफ। दो इंपॉर्टेंट कंपोनेंट, दो पिलर है शादी के। अगर इन दोनों कंपोनेंट में दिक्कत आनी शुरू हो जाएगी, मैरिटल डिस्कॉर्ड होने शुरू हो जाएंगे। और अल्कोहल सब्सटेंस अब्यूज के साथ इमोशनल और सेक्सुअल दोनों कंटेंट जुड़े होते हैं सर। So definitely problem will start, but not in the sense of no child, but
सर
relationship. Yes.
सर जैसे बच्चे होते हैं
Now,
जैसे
now
ADHD
participant, I
और ये
will.
इस तरीके की प्रॉब्लम होना क्यों स्वाभाविक है कि बच्चों को ADHD या LD प्रॉब्लम या SLD?
ऐसा कोई हार्ड एंड फास्ट रूल नहीं है अमित कुमार जी। बट एनीवे अगर कोई ऐसा होगा तो वी डिस्कस, बिकॉज आई थिंक द शॉर्टेज ऑफ टाइम बीके शर्मा जी इज वेटिंग एंड द नेक्स्ट स्पीकर केम on the platform. So I will request if something is there, we can share, we can discuss individually rather than on that platform. Sir, BK Sharma sir.
Yes, sir. Yes, sir. In fact, we are running short of time already. So personal request, you can contact Mr. Soni sir afterward also for your clarification of doubts. And now let's move on to our next session. Before that, I would like to say,
Sharma ji, मेरा कहना है कि अगर if he wants to continue, let him continue for a while because he's giving technical inputs. है ना? अगर technical inputs में if it's going to be valuable, then let Dr. साहब carry on for a while. 15 मिनट एक्स्ट्रा ले लेंगे कोई फर्क नहीं पड़ेगा.
okay.
It's such an
Right, so then take 10 minutes.
Thank you very much.
More
So
open,
nice.
please. You can have 10 minutes more. Sir.
So any relevant practical questions if you want to ask, please ask within time frame so that everybody can.
Soni sir, good morning sir.
जी
Sir, Sunil Chaudhary this side from Muskan Foundation.
जी sir.
Sir, I want to request, like, is it possible for you to share the PPT over here so that we can download directly instead of we sharing you each and everyone personally details to your mail ID?
सर मुझे पता नहीं यहाँ पे कैसे शेयर होगा, बट आई विल डिस्कस विद डॉक्टर शर्मा सर, मिस्टर शर्मा, बीके शर्मा सर, देन विल अपडेट यू, बट नो इशू, डोंट वरी अबाउट स्लाइड सर, आई विल गिव यू बेटर.
Sir, I'll add one.
I can share with you very individual slides.
Sir, I'll say one thing, all the things is available on YouTube also.
That we will share, Sunilji, don't worry, we'll share with you, material will come to you, don't worry. And if you need extra material for other patient's perspective or a management perspective, please let me know, don't worry. We are always here to help you people. This is not only one-time interaction, I want there should be a long-time interaction so that we can discuss the case individually, case with it. That's then the benefit of there. Otherwise, what is benefit for sitting and spending 2 hours here?
Yes.
So whenever you feel you can discuss any case with me, any patient you want to refer to PJ Chandigarh, always welcome. I'm telling you, we are here to help you people, right?
Okay sir, thanks a lot sir.
Right, मेरे हिसाब से और कोई ऐसा कोई क्वेश्चन नहीं होगा तो we can go ahead to, we can give this to Sharma sir and he can continue with next session. Thank you very much, Sharma sir. आप please continue कर लीजिएगा next session.
Okay, right, sir. Right, sir. And before sir leave the platform, I would like to say a few words for sir. Ladies and gentlemen, I would like to take this opportunity to express my heartfelt gratitude to our esteemed speaker, Dr. Kusan Kumar, Associate Professor of Clinical Psychology, Department of Psychiatry, Postgraduate Institute of Medical Education and Research, Chandigarh, Union Territory. Speaking session on today's webinar on understanding substance use disorder and its management. So your presentation was informative, engaging, and delivered in a very professional manner. Your in-depth knowledge and ability to communicate complex concepts in an accessible and engaging manner were truly remarkable. The valuable insight provided will undoubtedly benefit all those who attended this webinar. So, on behalf of the organization and the participant of this webinar, I would like to express my sincere gratitude for taking the time to share your knowledge and expertise with us. Once again, thank you all. Thank you for your excellent presentation, and we are looking forward to learn more from you in future. Thank you very much, sir. Now, participant, our next speaker is on the screen. He is waiting for the next topic. And I hope that regarding the presentation, I would like to say that this webinar is available live on YouTube. Means you can get the recorded version of this webinar from the YouTube as well. I'll request Mr. Soni Saab to share me the presentation. Then further, I will share it on the WhatsApp group so that you can have the benefit of that. Let's move further. I hope there is no need of taking any sort of break in between. Should we go ahead? Should we move further?
Yes.
Continue, sir.
Please come. Okay, right. So now, before moving further, let me give a brief introduction of our next speaker. Our next speaker is Dr. Virendra Kumar Mishra. He is an IPS officer who currently serving as Assistant Inspector General of Police at Police Headquarters Bhopal, Madhya Pradesh. He holds a PhD in psychology from Barkatullah University in Bhopal. Sir has had various positions in Indian government, including Director of the National Institute of Social Defense and Director of National Service Schemes. He also served in 2 United Nations missions in Kosovo and Bosnia-Herzegovina for 1 year each and worked as a pro bono visitor in the United Nations mission East Timor for 5 months. Dr. Mishra has contributed to various legislative and policy-making initiatives related to human trafficking, senior citizen, youth development, and transgender issue in India. He has authored several books and articles, served on various editorial boards, and was appointed as an external advisor to the National Commission for Women in India from 2022 to 2024. He is founder of Bhopal-based non-profit organization Samvedana. It was founded in 2002, and also the founder and chairperson of Suresh Mishra Foundation on Historical and Cultural Research based in the Bhopal. He represented India internationally in various events, including the SAARC Regional Workshop in Nepal and BRICS Youth Summit in China, honored with awards such as double Helical National Health Award and a Certificate of High Achievement from Sardar Vallabhbhai Patel National Police Academy. He also received a felicitation certificate for research and writing for marginalized and victimized group from Madhya Pradesh Police and Community Service Award from Institute of International Affairs, Department of State, USA. He is a very renowned, he is a very applauded officer. So now I will request sir to please carry on with your session, sir. Over to Mr. Sir.
Good morning, everyone, and thank you for having me here. So I was just hearing a part of the session which was being given by doctor from, I think, PGRI or from Chandigarh. So it was quite an engaging session, and the best part about the session was that it was two-way communication. That is what I loved about it. Because if we speak, if somebody keeps on speaking, and from the other end, if there is no interaction, then perhaps the online thing becomes the worst medium of communication. But if it is two-way, then it somehow replaces the offline session. So coming to the subject, what I saw was my predecessor was talking quite technical things about drug abuse or substance abuse, and the questions that you were putting to him and the answers which was coming was a bit technical. So I, not being from that background, neither from the clinical psychology background, neither from having anything like, doctorate in any of these subjects, because my subject is altogether different, in which I did my PhD. But being the head of NISD, I mean, the director of NISD, had a chance to understand the subject a bit. And what added more was my stint in NYKS and NSS, Nehru Yuva Kendra Sangathan and National Service Scheme. So these two experiences, helped me understand what are the challenges that the community is facing, and how do we need to, address those challenges. So when I used to talk when I was in NISD, drug addiction, as we call it, substance abuse. So, this is one subject we talk from very technical perspective. And I call it like, it's a very unfortunate thing. Because when we talk about technicality, we talk about cure. We talk about persons who are already there in, who have already become dependent here. So, and the focus totally, is there on the cure of the people who are already dependent. Now, I'm talking about the other aspect as well. That is very important. And the government of India has IRCAs. So, IRCAs are basically the de-addiction centers, so-called, of the government. And many of you I see that are representing IRCAs here in this platform. So, the role of the IRCAs is to help them cure. But NISD came out with many programs for prevention as well. So why prevention is important? That is what I would like to focus here on. As I said, like when I was in NSS and NYKS, what I came to realize that India, as we claim that we are having this demographic dividend. So demographic dividend means that India is a youthful country. So when we say India is a youthful country, it means that India is full of youth. Now the question comes like, is it just, hype created, or is it a reality? And if it is a reality, then how much do we understand about it? What is the age for a person to be called youth? As per the National Youth Policy 2014, and the new youth policy perhaps was being framed, I don't know if it has already come out. You can, add value or help me do that. So if you understand, like, if you understand the National Youth Policy, it says any person falling into the bracket of 15 to 29 years is a youth. Just imagine, 15 to 29 years is a youth, and the average age of India's population is now 29. So just link those things. When we say India is a youthful country, it means that the average age of Indian population is 29. And that means they are youth. And what are we talking about when we talk about population? We are talking about 142 billion, 1.42 billion basically. So if we have more than 142 crore people here in this country, and of that population, if the average age is 29, so we can claim to be either, like, we can bask under the glory of being most youthful, or otherwise we can be stressed saying that, we have a lot of responsibility, because if these youth goes direction, let's just imagine how much havoc they're going to create. And biggest challenge that we are facing is drugs or substance abuse now. As we were discussing when I was an NISD director, when I was talking to this NDDTC people, like, who are from AIMS, I don't know if there is some representative here. They used to say, like, after doing the extent and substance abuse report, which was published by Social Justice Ministry, they said that the amount of drugs which are confiscated by law enforcement, when we talk about law enforcement, particularly in substance abuse, it comes like, the police is there. Besides that, the National NCB is there, Narcotics Control Bureau. They also play a very important role there. So the law enforcement, the amount of drugs being seized or confiscated by the law enforcement is hardly, I think what I heard, maybe now I may be wrong, if somebody remembers that, correct me please, but it is not more than 10%. If I don't remember the exact percent, but of course it is not more than 10%. So 10% of the drugs in the market, this is what the NDDPC experts said. So 10%, less than 10% of the drugs which is available in the market is confiscated by law enforcement agencies. Now you can see NCB has become proactive. They're doing great job. So are the other law enforcement agencies. But still, the drugs in the market is so huge because if you know, as per the UN, observation or the report, the three main organized crime which is spending maximum money is drugs, human trafficking, and weapons trafficking. So because a lot of money is involved, just by confiscating some of it won't deter these people. And that is why we see that those stringent actions are taken, but still, there is drugs all over. Now we need to connect that youth and drugs. If somebody has to hit a country, if somebody wants to destabilize a country, what is the best way of doing it? Is to just destroy the generation, and India's generation is going to be youth. So we hit on that generation, that population. I think our growth rate, which is envied by globally now, which is going to be hit strong. I think Mr. Chuana, I mean your mic is has to be from Mizoram. Chuana, your mic is muted, so please mute that.
You're muted. You're muted. But you're on mute.
You are in mute, sir, I think. I think you are in mute, sir.
Mishra sir, your microphone has gone on mute.
Please unmute yourself, Mr. Sir.
Mishra sir,
I got it.
Your mic has gone on mute.
Thank you. Thank you.
Thank you.
So what we have to understand is that the population of India is youthful. The drug menace is there. Any country would love that this, the drug menace, which should go viral. People should get into it. They become addicted so that the economy of the country is destabilized or unsettled. And that is what the danger is. So we have to understand from that perspective. If you understand it from that perspective, then our approach is going to be different because the perspective that you carry decides on what sort of approach you are going to have. As I said, focusing on drug dependence is good. I mean, that is wonderful. We have to do it. We have to save lives. But at the same time, we have to see that we have to prevent people from getting into drugs. There is a term that we use nowadays, preferably in social sector. They say that we should not use the word addict, but use the word dependence. Even I remember when I was in the ministry, we were discussing if the term addiction from IRCA should be removed or not. Because if you say somebody he's a drug addict, then there is a lot of stigma attached to that word. So you look at that person as if he has erred, he has done wrong, he has committed a sin, and you have come there as a messiah to save him. The approach changes. I'm telling you, this is all psychological. What we talk about is, rather than calling them drug addicts, if we tell them drug dependent. So when we say drug dependent, then approach changes because we start looking at why did he become dependent? Somebody is dependent on someone. A child is dependent on a family member or father or mother. So if we say dependent, the responsibility of the social justice system comes into play. That is the difference. So rather than calling addiction, like, if we tell them they are dependent, then we realize that if at all a person has become dependent, then it is just because the social justice system, which was supposed to deliver and protect them and create a protection network, or net at least, has failed, has miserably failed. That is the paradigm shift which is required now in, approach towards drug dependence. We have to start thinking that he's not a victim. As we say, very recently when we're talking about what is the change happening in this country now, and which we are pioneer about, the country is pioneer about, is that right? Rather than being, having only the criminal legislations, we have shifted it towards socio-criminal legislations. This is a shift which is happening in this country, socio-criminal legislations. The socio-criminal legislations means where a person who is committing the crime, as so-called, if at all we call it crime, is not considered to be criminal at the first instance. For example, in Juvenile Justice Act, any child, any person under the age of 18, if he suppose commits a crime, is not considered to be a criminal. That is why we have observation homes for a delinquent juvenile. We don't have a detention center in this country. Across the world, it is more or less detention centers, but in India, it is not detention center. It is observation homes. Why do we call it observation homes? Because we believe that if a child is committing something, he's erring, he is committing a crime, then it is the failure of the social justice system. Similarly, in case of Immoral Trafficking Prevention Act, when a woman gets, when she's prostituted, so at the first instance, even the government this time, even the Supreme Court said that, you are not supposed to treat them as criminal. In the first instance, we are not supposed to treat them as criminal. Very similarly, in these cases also, when we tell the law enforcement agency, even in NISD, when we used to do the training, we used to tell them, please don't treat the drug dependents as criminals. When a person gets into drugs, there are three stages which we call one is drug use. When a person starts using drugs, that is the stage we call as drug use. As per the NDDT report, when they said that when they use the term use is when a person at least tried once or twice and who is not totally dependent on drugs in a year. They were termed as use. So there is a stage is drug use, and then second stage is harmful effect of the drugs, and the third is the drug dependence. When a person is getting into drugs at this earliest stage, a study again says that they're introduced to drugs because of the peer pressure. It is the peer who normally introduces them into drugs. So if a peer can introduce them into drugs, there can be a peer which can save them from using the drugs. So here we need to create a strong social security net so that the person doesn't get into drugs at the first stage. The second stage is when the person is using continuously drugs, then they start realizing, feeling that they in their body that it is causing some harmful effect in them. Very similar to what happens when you have fever. When you have any ailment, what is the first response of your body? You feel that you have fever, you have pain in the body. So that is how the body starts saying, okay, your body is not perfect right now. There is some problem here. Some outside element or some ailment is there in you. So that is how it is reflected through fever or some pain or some other things. Very similarly, a person who is into drugs, when they are using it in the beginning, they may say that, okay, I'm enjoying it. But there is a stage when they start realizing that, okay, there is something going wrong in my body. That is the stage of harmful effect. And the third stage is drug dependence, when what we call as addicts, when they cannot, it's very difficult for them to come out of it. So at the stage of drug use, me, you, everybody in the society can help them come out of it. It is easy for them to tell them, okay, come, leave it. At the stage of harmful effect also, what they do is normally they look for some support, because they are at that stage from where the body is craving to have that what they have been taking continuously. Even there, if we give that social support, they can come out of it. But once they get into the drug dependence stage, then it is very, very difficult for them to pull out on their own. Then medication is required, could be meditation, could be whatever, but external support is very important. Without that, they cannot come out of it. We need to understand this. So if we understand the 3 stages and we understand that they are not addicts or they are not criminals, then if the society, as I say, social justice system starts playing role. And when I say social justice system, it is not just the departments, it is not just the governmental or bodies which are supposed to play a role. Every citizen of this country has to play a role in social justice system. Then only you give justice to others. So there we have to create a social security net right in the beginning. As a peer is pressurizing them to get into try the drugs or substance. At the same time, there should be a strong network which should be created and which should help them come out of it right in the beginning, or even at the stage when they are in that harmful effect stage. And I think this is what is today's workshop about. You read the title of the workshop, it says building a strong community, empowering civil society to combat drug abuse and addiction. So we have to create a strong community and the community around each other. So there are 3 things which happens. Normally, if you're working on a subject, there are 3 things that you have to do. As I call it, CCS. It's a CCS model. If you have to do anything, approach a problem, then you have to have a CCS approach. CCS stands for, first C stands for conceptual literacy. It's every person, every citizen should know what is drug menace, how problematic or troublesome it can be. Everyone should know that. For that, you go to the schools, you go to the colleges, you work in the community, you go work with all, not organized sector as well as organized sector, could be labor or anything. So go to all places and talk about what are the challenges of that they are facing if they get into drugs, into substance abuse. So this is talking to everyone through awareness programs is called conceptual literacy. The first part of C. The second C of CCS model, C second stands for conceptual clarity. So conceptual clarity is what is required for all the stakeholders who are trying to combat this menace. This is what is required by them. Like if people are here in IRCAs, if people are there as counselors, if they are their doctors, clinical psychologists, or whoever, all the stakeholders, even the NISD, the people in the ministry who are framing the policies, who are doing the law, everyone need to know, they have to have a conceptual clarity. Half-heartedly, you cannot do that. So the second stage is conceptual clarity, where all the stakeholders who are directly involved, either in intervention or in policy making, law making, they have to have a clarity about the things. This is what is the second thing that we need to do. First was conceptual literacy, that is spreading awareness amongst everyone so that we can create a strong social security net. Second is conceptual clarity that the stakeholder should have. And third is the skill set, the people who are directly intervening. Their skill set should be improved. When I was there in IRCA, not in IRCA, in fact, when I was there as director in ISD and I used to interact with IRCAs. I used to find that many counselors, retention of the counselors was very low in IRCAs. People used to come, move out. I say that even if people come and move out, but right in the beginning, if you provide that orientation to them, then you are sending in the community, so again, a good person. Maybe they are moving out because of some personal reasons, could be because of economic reasons or whatever, I don't mind about it. They have all the choice to move and explore the world for their benefit. But the responsibility of the IRCA is the moment somebody comes into the ambit, who is going to work in this field? Their capacity should be increased and worked on. So that is why I used to say them, immediately give them an orientation program so that when they go to the market, even after living there, So at least they will be, their capacity will be improved and they will be competent enough to work in this sector. I don't care. I have left NISD almost, it's 2 years now. But still you can see how passionate I am about drug dependence. It is just because.
Sorry, you muted. Sorry, you muted.
Okay, it automatically gets muted here. So I'm sorry, that's perhaps some technical thing. After some time, it gets muted automatically. So like, despite leaving the NISD, you can see the passion that I have about drug dependence in this particular field. It is just because when I was in NISD, it has gone into my blood. It has gone into my DNA, saying that this is a problem, a huge problem, which perhaps we are already facing or we are going to face in coming future. And at the same time, we have youngsters and there is a problem of underemployment. There is a problem of education. And when I say there is a problem of education, it is because now I've gone back to Bhopal and I'm seeing that we have more than 40 universities in one small city, Bhopal. Just imagine who are going to be the, the teachers and the educators there, who are going to be the professors there, what quality of education we are imparting to our youngsters. And the second challenge is the virtual world that we are playing with, we are toying with. It has become a playground for us. Everyone is all the time into virtual world. I don't know, like if you have heard the term about simulacrum. In cyberspace, we call the term simulacrum. Simulacrum is that when you suppose we are sitting here and somebody takes a photograph, I would request Mr. Sharma that please take a photograph, you can send me what I'm doing here. So like, if you take a photograph here, so that is going to be a real photograph, which we post in a virtual world in LinkedIn or some other place and say that, okay, this is what is being done. We were here and we did it. But what happens in virtual world, it is not limited to what is real, which is posted in in the virtual world. Gradually, it gets simulated. A story is built around it, and the story keeps on building, and it is built to the extent that it is no more close to the reality. And that is what now, that is called simulacrum effect. So that is what now we are, handing over to the youngsters who are always on social media. What they see is maybe not even an inch close to what you call it, reality. Just imagine what world we are facing right now. There is another concept in cyberspace, because I'm talking about cyberspace because this is what the youngsters are facing, and there is that is the place where they spend maximum time. There is a term called mimetic desire. You know what mimetic desire is? Mimetic desire is when you see somebody and that generates a desire in you. A simple example is, suppose, like, with a lot of difficulty, my child is saying that, okay, my children are saying that, oh, you buy a car, and I buy a car and bring the latest. I say that, okay, let me buy a Duster. And Duster is not within my budget, but still I extend myself and push my boundaries and buy a Duster. And the Duster comes to my home, everybody is there with agarbatti and the lemon and flowers to celebrate that we have got a Duster now. And suddenly at that moment when we are just doing the agarbatti, a Mercedes comes and stands next to that. All the happiness of the children is gone. They'll start thinking, why don't we have a Mercedes next, which has been just parked next to us. That is called mimetic desire. This is what is happening in cyberspace. They see everyone doing something, and despite knowing that perhaps I'm not built for that, I'm not cut out for that, I don't have the capacity to do that, but still they start aping that. Or in a better sense, if I say, they will try to emulate it. But do they have that competence to do that? It is not there. So that would lead to stress, that would lead to tension, that would lead to frustration, that would lead to desperation. And the solution to all these things, as our predecessor speaker was saying, even for what happens to the Bollywood stars, substance abuse is considered to be the solution to a panacea to all these problems. So this mimetic desire that cyberspace is creating it. So are we trying to even think from that angle? That's what I'm saying. When we are saying we want to strengthen the community, then we have to build the capacity of the people, the stakeholders who are there in intervention, be it at the policy level, lawmaking, or all these, people, the good people who are sitting here today in this session and who are making a difference there in the ground. Your capacity also has to be, has to develop, and you have to always be on the ball. Try to learn the latest things. What are the developments? What are the pressures which are forcing the youth who are in large numbers? So underemployment, the frustration created by this mimetic desire, all these things have to be factored in when we are doing that. So what I think is, if you ask me personally, community has a very, very important role to play. Fighting against substance abuse is not one man, solution, neither one organization solution. So that is why, the peer CPLI program that we started in NISD was very optimistic program, and I hope that it is doing very well. Where peer-led intervention was considered to be, and peer-led intervention we thought is one way of engaging the community directly. It would include the first factor, the conceptual literacy, and at the same time it is going to include the conceptual clarity part and develop the skill set of the people. So this is going to be very important. One other thing about when I was hearing the questions, one lady, I think, was asking perhaps the speaker, that the boy says कि छूट नहीं सकता है. मैं अब आ गया हूँ इसमें, ड्रग डिपेंडेंट बन गया हूँ, तो छूट नहीं सकता. Let me tell you another, very live, very akin to what she said. I have a domestic help here who has been there in our place. She has been helping us out for years now. Her son, time and again, falls into this trap. And it's a total peer pressure because they live in a slum in Delhi. So they were sent to de-addiction centers. But after some cure, they used or treatment, I would say, whenever the child used to come back, or now who is a youth now, after some time again, there used to be relapse. So she used to come and say that the boy says that I can't help it. It cannot happen. So that's what I told them, what the de-addiction center is doing their job. When the child is there with them, they are trying to support, build that confidence. But once the child goes back into the same community, then the challenges are same, and it is easy for the person to relapse. When we talk about, because I work a lot on human trafficking, and you know that drug and human trafficking is very closely associated. As earlier we used to talk about narco-terrorism. This is one aspect perhaps we missed upon. Narco-terrorism is a big problem across the globe. Narcotics and terrorism. The money generated from narcotics is so huge again that the terrorists get funds from that, and that helps them carry on their activities. So similarly, human trafficking also, we say that narco-human trafficking is again very closely associated, where the victims are either drugged, or the traffickers use drug, or use those victims who are drug dependents and traffic them. So there are n number of cases because the vulnerability of the person increases who is a drug dependent. So when we work on human trafficking, so we tell them that reintegration and rehabilitation, two things that we work on here. We also say rehabilitation in IRCAs or dependent centers or other places. We talk about rehabilitation. Rehabilitation means trying to build the capacity of the person so that when they move out, they get mainstreamed, one. And second is, how do they get mainstream? Let us give them some skill. So by their skill set, they can engage themselves. But just mainstreaming is not sending them back to the community where they are coming from. Of course, it is not that, if a drug dependent wants to go and stay in the family, they are not allowed to go to the family. They are supposed to go to the family again. They are supposed to go to the community where they have come from. But unless and until the vulnerability, the causes, factors of vulnerability which is leading them to fall into this is not taken care of. So till that time, if we just go and reintegrate them, it is certain that the victim or the person is going to be, if I use the term victim, I don't know if I'm allowed to use the term victim for a drug dependent, but if at all they are these persons who get into, fall into this trap, even if they are cured, but if they go into the same situation and if the vulnerability exists, continues, persists, then the chances of them not being, again, of no relapse is very less. The chances of relapse goes many times high. So that is why if we are working in a system, if you are working in an IRCA, what you are supposed to do is you have to check the community and strengthen the community where they are living, create a social security net, do something there so that the person who is coming back into the community where we are trying to mainstream them, their vulnerability, the factors of the vulnerability because of which they got into this is attended or addressed. So, mainly this is what I wanted to talk about. If there are some questions or if there are something like, which you would like to ask me, I would invite. Sharmaji, I think my time was till 12:30 or what?
Sir, you are in time, sir. There is no issue, sir.
Acha. Nee, because
I request participant to please come out with some of the questions.
If they come out with questions, fine. I would take the questions. Because the problem of online system is when you start speaking and continuously speaking, you feel that you're speaking to the screen. And there are some photographs which are pasted on the screen and you're talking to a photograph. So that is why, you need to break, take questions if at all it is there.
Exactly, sir.
And I don't know, if you guys know that many of the teachers during the COVID time had psychological problems because of that. They had mental issues, mental health issues, because of talking to the screen day in, day out. And because all the children used to mute themselves, they used to switch off their videos. And it was like talking to talking to themselves, in fact, because you see yourself only. So that's dangerous, I think. Anyone, please, if you have any questions or if you want to add anything, because I'm on a learning curve. All the time I'm on a learning curve, please.
Hello.
Can I speak, sir?
Hello.
Please ask that.
Am I audible, sir?
Yeah, you are. Please.
Sir, it's not a question, but it's a suggestion. After working for almost 2.5 years with ODIC, that we need more IRCAs in our state, Uttarakhand. There are only 2 IRCAs. One is in Chamoli, the other one is in Pithoragarh. So if I have a client who needs 24 hours.
Can you repeat the question? Perhaps, you broke, somebody spoke in between.
Oh, sir, I'm saying that after working with ODIC for 2.5 years, I have realized that we need more IRCAs. If we have a client who needs 24 hours help, we have to send them either to Pithoragarh or Chamoli, and it is physically not possible to send everybody there. And the private centers, they charge 8,000 rupees per month, and our clients cannot afford that. So it is my request that maybe tender for more IRCAs. No?
Yeah, that's a good suggestion. I don't deny that. We need to have more centers and
in Uttarakhand, sir.
Yeah, if not the government led, then certainly, because government have their own limitations. The funds are limited, so they can't keep on opening it. But at the same time, private players also should come forward. But one thing which is required is a regulatory body, to check what is happening in IRCAs. Particularly in private sector, there is no regulatory body, so that becomes a challenge. We have heard not many stories the way that drug dependents are being treated. As I said, because the mindset is that they are not, they're not a victim of the failure of social justice system. The mindset says that they are just there's a lot of stigma attached to that. So the behavior of the people who are working on with the drug dependence is altogether different. So we have to work on that.
Yes, sir. Thank you.
Excuse me, sir. I am from Una in Himachal Pradesh. Una is a district. So there are about 28 to 29 de-addiction centers, which are not properly governed by the government. And they are just money minting institutions. So,
Yeah. I mean, it's very difficult for me to comment on that. You are there. So, I mean, I take what you say. Certainly, that has been many people who are working in the sector, in social sector, have become businessmen. So, and working in social sector needs passion. You have to understand the pain. You have to understand what is the need of the social sectors. So, if you convert it into a business, then certainly you cannot do justice to the work that you are doing. So they will certainly try to make money out of it. But that is very unfortunate part of, of the situation. So,
Hello.
So we should try to discourage that. Yeah.
हेलो
जी बोलिए प्रवीण जी.
हेलो हाँ जी नमस्ते सर. सर मैंने आपसे क्वेश्चन करना है कि जो नशे की प्रवृत्ति ज्यादातर स्लम एरिया में क्यों देखने को मिलती है, छोटे छोटे बच्चों में, क्या कारण है? हेलो
जी हाँ प्रवीण जी, उसका बड़ा रेलिवेंट क्वेश्चन आपने पूछा है कि ये स्लम एरियाज में क्यों.
हाँ जी सर.
तो ये स्लम और उसका नहीं है. देखिए आपको दिखता स्लम्स है, बट ड्रग्स तो आजकल सब्सटेंस अब्यूज तो स्टाइल स्टेटमेंट हो गया है आजकल. और
सर वो ना छोटे छोटे बच्चों में मैंने देखा कि ज्यादातर बच्चे स्मोकिंग से चालू होते, जैसे भांग ये तो आम ही करते हैं छोटे बच्चे, क्या कारण है?
मैं आ रहा हूँ प्रवीण जी, मैं उसी पे आ रहा हूँ. मुझे बोलने दीजिए तो मैं आपको पूरा समझाता हूँ. ये जो वही मैं बोल रहा हूँ कि एक ड्रग सब्सटेंस अब्यूज के बारे में बहुत बड़ा भ्रम है कि सिर्फ क्या कहते हैं स्लम्स में ही होता है या इसी तरीके का होता है. वहां भी होता है और बहुत होता है, क्योंकि सिचुएशंस, जैसे हमने बताया कि ये देखा जाता है कि सब्सटेंस अब्यूज शुरुआत, जो ड्रग यूज का जो स्टेज होता है, उस टाइम लगता है कि सब चीज का इलाज, जैसे पेनेसिया में बोल रहा था, सब चीज का इलाज जो है सब्सटेंस अब्यूज में है. तो बहुत चीजों की लिमिटेशंस होती है, बहुत चीजों की कमियां होती है. और आप जब पड़ोस में देखते हो कि सब कुछ मिल रहा है, स्लम्स कोई बाहर गांव मतलब बहुत दूर शहर से तो है नहीं, स्लम शहरों के बीच में फंसा हुआ है. और स्लम्स बीच में फंसा हुआ है तो बगल वाले घर में अचानक जो घर चालू होता है उसमें देखते हो बच्चे जो हैं ऐसे चीजों का क्या कहते हैं, सारे जितने भी लोभ हो सकता है वो उनके पास है उपलब्ध, सारे जितने मेटेरियलिस्टिक है उनके पास हो सकता है, और वो जो स्लम्स में रह रहे हैं बिल्कुल पड़ोस में उनके पास नहीं है. तो एक ये जो वही मिमेटिक डिजायर वाला जो बोल रहा था, वो एक स्ट्रेस देता है, टेंशन देता है, एक ये फील कराता है कि मुझे ये नहीं मिल रहा है. तो इसके लिए जो है एक भ्रम हो गया है सब में कि ये रास्ता है निकलने का बाहर. सब्सटेंस अब्यूज अगर आप करते हैं तो निकल जाते हैं आप रास्ते से. तो ये जो चीज है, इसलिए अवेलेबल मार्केट में इसी जो मानसिक कमजोरी की बात है, उसी का फायदा उठाते हैं जो ड्रग ट्रैफिकर्स हैं और उसको सप्लाई करते हैं और थ्रू पीयर प्रेशर से उसको दिलाते हैं. मगर इसके साथ में ये भी मैं बोलना चाहूंगा कि ड्रग्स अब सब्सटेंस अब्यूज, ये कहना गलत है कि सिर्फ स्लम्स में ही है. वहां जितना है उतना ही अब बाहर है. अब तो ये स्टाइल स्टेटमेंट बन गया. कोई पार्टीज नहीं होती खत्म जितने हाई लेवल एंड पे, हाई एंड पे ज्यादातर पार्टीज जिसमें कि सब्सटेंस अब्यूज नहीं होता है. तो ये एक जिसे कहते हैं ना कि ये प्रॉब्लम व्याप्त हर जगह पे है, हर लेवल पे. इट हैज कट अक्रॉस क्लास, कास्ट, रिलीजन, creed, everything. You cannot say that these are the only people who are taking it. It is no more that. It's altogether different. अभी मैं किसी एक मित्र के यहाँ बैठा हुआ था तो उन्होंने कहा कि हमारे 10वीं के बच्चों की पार्टी है. तो मैंने कहाँ कर रहे हैं? बोले कि मैं घर पे प्लान कर रहा हूँ. मैंने कहा घर पे प्लान कर रहे हैं तो अच्छी बात है, घर पे प्लान कर रहे हैं, बट बोले कि हाँ इसीलिए कि बाहर जब जाएंगे तो क्या पियेंगे क्या खाएंगे हमको पता नहीं है. अगर कुछ करना ही है तो बहुत ज्यादा हुआ तो बियर घर पे पी लेंगे, उससे ज्यादा तो कम से कम नहीं पियेंगे. अब बताइए 10वीं के बच्चे के लिए घर पे ही अगर ये बोल दे कि बियर पी ले तो कोई फर्क नहीं पड़ता है. ये तो बहुत कल्चर का पार्ट हो गया ना. तो ये तो खतरनाक तो चीजें हो ही रही है।
मैडम आवाज आ रही?
जी, और कोई?
Sir, good afternoon.
Yeah, good afternoon, please.
मैडम आवाज
Good afternoon. Can you hear me?
प्रवीण जी, आप अपना माइक बंद कर लीजिए।
Hello.
प्रवीण जी, अपना माइक आप म्यूट कर लीजिए। जी, थैंक यू।
Hello.
हाँ, बताइए रामनाथन। मिस्टर रामनाथन, you were speaking something.
Sir, how to identify the persons? Because we are now talking about the prevention and all those things. How to identify the persons? How those who are supplying drugs? How those who know they are supplying rackets? Is there any way to identify?
In fact, rather than saying that, how do you identify them? Because it is very difficult to straight away cross question your children nowadays or the youngsters, because they take it otherwise. This generation has changed. The best thing is to be very close and friendly with your, with the people who are there. That's why I said, the role of the community is very important here. The more friendly you are, you will be able to figure out if there is someone going astray. There is a strong behavioral change that you're going to see, a person getting into drugs. You can figure out. I mean, you easily come out if somebody is getting into drugs. So they would try to withdraw from that. Their concentration is not there. Only with a particular group of friends they're going to work with or play with, if we are talking about children. So you can see that they become very, very selective over a period of time. So then, rather than straight away saying that, are you into drugs? You don't ask this question. You have to observe. You have to be friendly with them. And believe me, the children normally, when they start suffering, when they are in that stage, so they would come and confide in you. But the problem is the stigma doesn't allow that communication to happen. That's why I said we have to work on our attitude rather than their.
ఇలాంటి ఈజీ చెప్తే చేస్తారు. అందరూ పేపర్ తెచ్చుకుని పేపర్ తీయమని మడతలు పెట్టి
Radhika ji, please mute yourself. So what we have to work on, rather than working on their attitude straight away, directly, first we have to work on our attitude also. Our approach towards the people whom we suspect to be using drugs should be different, should be more friendly. Any other question, please?
Hello.
Yes,
sir.
Yeah, Mishra sir, my name is Shubhimal Banerjee, and I'm calling from SPYM. And I have had the privilege of being in some of your sessions, and I literally. Hello.
I remember you very well.
Thank you so much. I am privileged, sir. I literally enjoyed your today's presentation, in the sense that the first thing that you said, and you are also aware that I am an ex-user. Okay, last 6.5 years with blessings of people like you and with God's grace, I'm going good. अच्छा, अब आपने जो एक बात कही वो बहुत ही महत्वपूर्ण है, that is कि ये start तो होता है एक बंदे के लिए मजे से, but at a later stage this person starts feeling that he is in trouble, and that is when he needs the help. ठीक है, अब ये उस वक्त उसको मदद की बहुत जरूरत होती है. यू आर वेरी राइट सर. वो अपने आप में परेशान होता है, बट ही हैज नोवेयर टू टर्न टू. दिस वाज वन थिंग दैट वाज वेरी परफेक्ट व्हिच यू सेड. एब्सोल्यूट ग्रास रूट लेवल टॉक. अच्छा, दूसरी जो अच्छी चीज आपने बताई कि मर्सिडीज वाली ख्वाहिश, जो ख्वाहिश एक बच्चे को लेके कहां से कहां पहुंचा देती है, एंड द सोशल मीडिया इज लिटरली बूस्टिंग इट अप. ठीक है, अब एक चीज जो सर काम करती है, भले ही धीरे काम करती है, दैट इज द इंट्रोडक्शन ऑफ थेरेप्यूटिक कम्युनिटी प्रोग्राम, विच आई थिंक सर शुड बी इंट्रोड्यूस्ड. आप तो खुद सर देश विदेश में घूमे हैं, एंड यू हैव डन द ग्राउंड वर्क लिटरली. I can understand this from whatever you have spoken. I have understood each and everything of it, sir. और ये चीज अगर मेरे को लगता है इम्प्लीमेंट हो सकता है, तो ये बहुत बेहतर और कारगर साबित होगा. क्योंकि थेरेपेटिक कम्युनिटी ट्रीटमेंट में सर, यू विल अप्रिशिएट द फैक्ट कि वहां पे किसी को ना शेमिंग नहीं किया जाता, उन लोग को मोटिवेट किया जाता है. आई लिटरली विश दैट यू कुड बी गिवन सम एक्स्ट्रा टाइम, एंड आई एम श्योर कि अगर आपको थोड़ा एक्स्ट्रा टाइम मिला होता तो आप इस टॉपिक को भी एक बार जरूर डिस्कस कर लेते. थैंक यू सर.
Thank you so much. Thank you so much. And thank you for again, interacting with me in long time. ये जो आप बता रहे थेरोपेटिक वाला जो कम्युनिटी सिस्टम जो है वो बहुत बहुत जरूरी तो वो है ही, हर चीज पे है, क्योंकि हम लोग जब बात करते हैं, बिकॉज आई नॉर्मली व्हाट आई डू इज आई ट्राई टू ड्रॉ पैरेलल्स बिटवीन ह्यूमन ट्रैफिकिंग एंड ड्रग अब्यूज, because in both stages they are victim of circumstances basically. That's what I call them, the victims of human trafficking as well as the victims who get into drugs. So what happens is, when they get into that, the maximum damage that happens is psychological for any victim, either be it human trafficking or criminal, this thing, drug dependence. The damage is more psychological, as we call it, the mental health issues, the other things. We need to create a very strong net. The medicines can be given, but medicines are limited effect, and it cannot be continued forever, because that itself will become a problem then. लोगों को एक दवाई से निकालते हैं और दूसरी दवाई का हम एडिक्ट बना दिया। कुछ लोगों को नींद नहीं आती है, नींद नहीं आती तो कहते हैं नींद की दवाई लेना शुरू करो, चालू हो जाएगा, इसके कारण नींद नहीं आ रही है, और पता लगा कि उनको एडिक्शन नींद की दवाई का हो गया। So what we need to do is, we have to, as he said, Ranji Sahab said, that is very true. We need to have a community, it's a strong community, because as I've been repeating time and again about the social security net that you have to develop. So उसी का एक ये पार्ट है therapeutic वाला जो community develop करना है, and particularly shaming, जो stigma की मैं बात कर रहा हूँ, stigma का वही हुआ उसका कि shaming बहुत जबरदस्त होता है। अगर मुझे, मेरे बच्चे को, मेरे पड़ोस में कोई आके बैठते हैं ड्रग डिपेंडेंट, अगर कोई आके रहना शुरू कर देता है, तो अगर मेरे बच्चे को अगर बोलना है खेलने के लिए, उस पता लगा कि उसके साथ इंटरेक्ट कर रहा है, तो सबसे पहली चीज जो मैं कहूंगा, आई एम टॉकिंग अबाउट, व्हेन आई से मैं, आई कांट गिव एनीबॉडीज एग्जांपल, बिकॉज़ आई टेक इट लाइक सब पूरे कम्युनिटी को मैं करके मैं यहाँ एड्रेस कर रहा हूँ। तो व्हाट आई वुड डू और एनी अदर कम्युनिटी मेंबर वुड डू इज कि पहला चीज हम बोलेंगे अपने बच्चे के लिए, विल टेल द चाइल्ड दैट प्लीज डोंट गो एंड प्ले विद हिम, बिकॉज़ वो नशेड़ी है। These are the terms, as I said, using terms defines what you think about them. जैसे कि ड्रग एडिक्शन एंड ड्रग डिपेंडेंस का मैंने आपको फर्क बताया। ड्रग एडिक्शन, द ओनस लाइज ऑन द person who is taking drugs, that you have erred, you have done the wrong thing, so that's why you are addicted. When we say drug dependent, then the onus lies on us, that we being the part of social justice system has failed in delivering what we were supposed to do. यानी उसकी गलती नहीं, वो डिपेंडेंट इसीलिए हो गया क्योंकि हमने उसको छोड़ दिया था। एग्जैक्टली इसी तरीके से स्टिग्मा जो होता है इसके साथ में, स्टिग्मा हम अटैच कर देंगे तो हो ही नहीं सकता। तो ये जो रिहेबिलिटेशन की तुमको बता रहे, थेरेपेटिक वाला जो पार्ट है, थेरेपेटिक कम्युनिटी ये वो देता है उसको कि जहां हम शेम नहीं करते हैं, बैठते हैं साथ में, जैसे वो लोग डिपेंडेंट है, सेम कम्युनिटी के लोग आते हैं, चाहे बाहर वाले लोग आते हैं, और रियलाइज करते हैं, एक दूसरे को अंडरस्टैंड करते हैं। इससे डायरेक्टली नहीं है रिलेटेड, बट एक बड़ा अच्छा कॉन्सेप्ट होता है, उसको कहते हैं हम लोग रेस्टोरेटिव जस्टिस। जो गलती कर रहा है, अगर वो क्राइम में हम लोग यूज करते हैं बेसिकली, बट एक ड्रॉ पैरेलल हम कर सकते हैं कि जो इसमें है और जो नहीं है वो भी अगर अच्छे से उसमें लेके अगर साथ में बिठाएं और चर्चा करना हम शुरू करा दें दोनों के बीच में, तो वो समझेगा कि वो कैसे गया, क्या हमने गलती की जो उसको छोड़ दिया हमने जाने के लिए, हाउ डिड ही गेट इनटू ड्रग एडिक्शन और ड्रग, हाउ डिड ही बिकम अ ड्रग डिपेंडेंट। They will understand where they failed, and at the same time the other person will feel and realize that, okay, because of being drug dependent, what were the stages that I went through and what damage I have done to myself and the community. Because a drug dependent is, now we need to save them, because it is not just one person, because when we say one person goes astray, it leaves an impact on the whole family, पूरा घर बर्बाद होता है, and when we say एक घर बर्बाद होता है, so it has an impact on the whole community, and finally it impacts the whole nation building. We have to understand this. That's what I'm saying. We need to change our perspective about this. Any other question, please?
Thank you, sir.
Hello, sir. Sir, I'm Shraddha Singh from Jagran, Patna.
Yes, Shraddha ji.
Yes, sir. So my question is, most of the youth started consuming drugs with their peer groups, and they shared their peer group for increase their consumptions. On the other hand, they earn money for purchase substance. Is this true factor?
I couldn't get it. Please repeat करेंगे आप question को?
Yes, sir. Most of the youth influenced to the peer group and the impact on the peer group of the drug abuse. My question is, they shared their peer group, they shared their peer group to increase their consumptions and earn money to purchases substance. Is this true factor? That's
मतलब
why they
आप ये
separate.
पूछना चाह रही हैं कि पीयर प्रेशर ही जो है उनको उसमें डालता है और उससे ही इंक्रीज भी वो कराता है ड्रग यूज
No, sir. The main reason of the peer
थोड़ा
factor is
हिंदी में मुझे समझा दीजिए, देन आई परहैप्स आई वुड बी एबल टू अंडरस्टैंड. आई एम मिसिंग आउट समथिंग हियर, प्लीज सॉरी.
मेन रीजन पेयर फैक्टर का ये है कि वो अपने कंजप्शन को बढ़ाने के लिए और पैसे मतलब कि सब्सटेंस को अर्न करने के लिए पैसे के लिए अपने पेयर ग्रुप को इन्फ्लुएंस करते हैं.
आई गॉट. सी ये जैसे कि बताया कि ये थर्ड वर्ल्ड का तीसरा सबसे बड़ा ऑर्गेनाइज्ड क्राइम है, तो इसका पैसे का तो बहुत इन्वॉल्वमेंट है ही. देयर इज अ ह्यूज मनी इन्वॉल्व. So certainly, like a person who becomes a peddler, his target is increasing just because he wants to earn more and more. No doubt about it. तो पैसे का तो इन्वॉल्वमेंट होता ही है.
सर मैं एक चीज पूछना चाहता हूँ.
जी.
ये नार्को टेररिज्म एक तरह से मार्केटिंग है ड्रग्स का पैसे कमाने के लिए और उसको टेररिस्ट एक्टिविटीज में यूज करने के लिए. तो जस्ट टारगेट टू सोसाइटी और कस्टमर्स. इसके बाद बच्चों में एक कॉन्सेप्ट है, जैसे आपने बताया कि स्टाइल आइकॉन या ऐसे कुछ समझते हैं. तो हम क्या हमारे लिए जरूरी नहीं कि हम सोसाइटी में जाके इस चीज को लोगों को जागरूक करें, क्योंकि प्रिवेंशन इज बेटर देन क्योर. दूसरी चीज ये कि अभी भी जैसा मैं महसूस करता हूँ कि लोग सोचते हैं कि जो ड्रग डिपेंडेंट हैं वो एक अलग कैटेगरी के लोग हैं.
ये आप जो बोल रहे हैं राकेश जी, बिल्कुल सही बोल रहे हैं आप कि जाना जरूरी है हमको. इसीलिए मैंने कंसेप्चुअल लिटरेसी की जो बात कर रहा था मैं, कंसेप्चुअल लिटरेसी का मतलब ये होता है कि हर व्यक्ति के पास आप जाएं और उसको बताएं कि क्या खतरा है क्या नहीं है. कंसेप्चुअल क्लैरिटी के लिए इसलिए मैं बोल रहा था कि पहले जब तक आप पूरी तरीके से चारों दिशा से नहीं समझेंगे, आप ड्रग्स को सिर्फ ड्रग्स मत समझिए, ड्रग्स के साथ में जो और चीजें हो रही हैं उसको भी समझना बहुत जरूरी है. अगर आप समझेंगे कि अच्छा टेररिज्म का भी ये पार्ट हो सकता है, ये हमारी इकोनॉमी को नुकसान करने के लिए भी इसको इंट्रोड्यूस किया जा सकता है, इसके कारण हमारा सोसाइटी का एक जनरेशन खत्म हो रहा है, उससे बड़ा नुकसान भारत को हो जाएगा, इसके लिए भी प्रयास किया जा सकता है. ये सारी चीजें अगर आप जानकारी लेके भी अगर यूथ के साथ जाएंगे तो दे विल सी दैट फ्रॉम ऑल होलिस्टिक एक अप्रोच रहेगा आपका. अगर आप किसी बच्चे के पास या किसी यूथ के पास जाते हैं और बोलते हैं कि ये मत करो क्योंकि अच्छी चीज नहीं है, कोई आज के दिन में आपका सरमन सुनने के लिए नहीं बैठा है. दे डोंट वांट प्रीचर्स, दे डोंट वांट टू बी सरमनाइज्ड. आजकल कोई भी किसी से प्रवचन सुनने को बैठा नहीं, मगर आप लॉजिकली साइंटिफिक अप्रोच से अगर आप किसी को बताएंगे तो तब वो समझेगा. इसीलिए क्लिनिकल लिटरेसी के लिए जो करने जा रहा है उसका कंसेप्चुअल लिटरेसी जो करने जा रहा है उसके लिए कंसेप्चुअल क्लैरिटी पहले होना बहुत जरूरी है. इसीलिए मैंने बोला कि स्टेक होल्डर्स का कंसेप्चुअल क्लैरिटी बहुत जरूरी है. पूरा हॉलिस्टिकली आप समझिए, आप ही लोग जो बैठे हैं पूरा हॉलिस्टिकली समझिए पहले कि क्या क्या कारण से ड्रग इंट्रोड्यूस हुआ रहा है, क्यों हो रहा है, क्या क्या इसका इलाज हो सकता है, कैसे किया जा सकता है. तब आप जब उनके पास जाएंगे बात करेंगे तो दे विल अंडरस्टैंड यू. सो अ साइंटिफिक अप्रोच इज द ओनली सॉल्यूशन. बट डू वी डू दैट? आई डोंट नो. वी डोंट डू. हम लोग जाते हैं, जब मैं देखता था लोगों के पास जाता था, जब पूछते थे उनका सिंपल यही कहा होता था, अरे ड्रग्स मत लिया करो, नशे लोगे तो ये नुकसान हो जाएगा, शरीर खराब हो जाएगा. अरे मेरे शरीर को हर आदमी से बोलिए तो वही बोलना पड़ता है कि अरे नाश्वर है तो आज है कल नहीं है. एक छोटा सा बच्चा भी आजकल फिलोसफर बन गया क्योंकि सुन लेता है वो कहता है कि हाँ अरे जाना तो ही, मिट्टी में मिलना तो है ही सर. ठीक है, देखेंगे. और दूसरा एक और आजकल जो लेटेस्ट बोलते हैं, अगर यंगस्टर से कुछ चीज बात करें तो बोलते हैं सर 28 साल की व्यक्ति को तो हमने देखा हार्ट अटैक हो गया था, तो वो कौन सा ड्रग्स लेता था. जब वो 28 साल में वो मर सकता है तो अगर हम 32 जी गए तो 4 साल एक्स्ट्रा मिल गया ना हमको. These are the logics that the youngsters give. But if you tell them, see, this is not just you, it is impacting the whole community, it is impacting the national growth, this is what the damage you are doing to everyone. कैसे हम जो जिस देश के बारे में तुम बात कर रहे हो, जिसके बारे में बात कर रहे हो, वो उसमें क्या नुकसान हो रहा है, ये आप समझाएंगे, पॉजिटिवली समझाएंगे तो आप देखिए कैसे मानता है वो. हर आदमी मानने को तैयार, बट समझाने की जरूरत है. हम किस एंगल से, वही जो मैंने बोला कि द पर्सपेक्टिव मैटर्स अ लॉट. when we are, handling such cases. I think we are done.
सॉरी सर,
Hello.
मैं डिस्कनेक्ट हो गया था।
जी।
तो सर मैं वही
अरे
पूछना
राकेश जी,
चाहता
हम तो
हूँ।
पूरा जान जी से इतना कुछ बोल गए और आप डिस्कनेक्ट हो गए। अब
सॉरी
उसको
सॉरी
वीडियो
सर।
देख लीजिएगा।
Yeah, hello.
Yeah, please.
So my name is Robin and I'm from Darjeeling. Okay. So I have
I
seen
know.
that person that is dependent on substance for many years have no skills left after using for many years. And after the treatment, he don't have got any jobs or he can do anything. All right. And they have nothing to do at all. So they goes into that dry drunk stage and eventually they fall on the path of relapse. Firstly, they mentally they relapse and they lastly they physically relapse. So until we come together and arrange something from them, okay, so we can help them building up their career or skills to survive, I think the recovery rate is not going to go up. Am I right?
I do agree. But one thing you have to understand, it's all psychological. Because they are not on the in sine wave. You see somebody is at the up and the second one is on the low. I don't know which one is the crest and the other one is trough. So if it is the trough is the lower one. So if the person is at the trough level, so what you need to do is tell them that, okay, you can reach the crest. It's not a problem. So that confidence you have to give. You must have seen a very recent, a doctor talking about his, brain tumor, and how he was cured just by himself. Like, he started working, he was taking the medicines, but at the same time, he focused on his, inner power. इंडिया में मेडिटेशन की जो हम बात करते हैं, मेडिटेशन के पावर को तो हम लोगों ने एक्सप्लोर ही नहीं किया। मेडिटेशन को भी हमने एक्सरसाइज बना दिया। एक और इंटरेस्टिंग चीज है कि हम लोग सोचते हैं मेडिटेशन इज अ पार्ट ऑफ एक्सरसाइज करिए और 2 मिनट के लिए आंख बंद करना हो, ये मेडिटेशन। दिस इज नॉट मेडिटेशन। मेडिटेशन कहते हैं कि रिवायर करता है और अच्छे से अच्छे प्रॉब्लम को स्ट्रॉन्ग कर देता है वो। So that is why we were, requesting the Irkas when I was there that yoga should be one thing which you should do it, but only through very, very, good teacher who can explain them what is the benefit of it. Every can rewire their brain, but only thing is they have to realize themselves that they have the power.
જ્યાદા હડાનો પહેલાની ચાલુ થઈ છે તો પૂરી ના કરી દેવી જોઈએ, ટાઈમ તો થઈ ગયો।
आशा पटेल जी आप कुछ बोल रही हैं मगर मैं समझ नहीं पाया। So, that's what I'm saying. So, like, what you're saying, it's never a lost case. It's never a lost case. There is, always with optimism, and you will find that you can. जी।
हेलो
जी प्रवीण जी।
हेलो, नमस्ते सर, मैं हिमाचल प्रदेश से बोल रही हूँ। सर मैं ये पूछना चाहती हूँ आपसे कि नार्कोटिक्स एनोनिमस कार्यक्रम क्या है? बोला जाता है कि अगर जो इसके अंदर जुड़ जाए तो वो नशा छोड़ देता है, उसकी रिकवरी निकल जाती है।
वही जो बात अभी बनर्जी साहब बोल रहे थे वो उसी की बात है कि वो जो एनोनिमस का मतलब ये होता है कि लोग आते हैं और अपने बारे में बताते हैं, बट कोई भी उसको शेम नहीं करता है, कोई भी उसको उस नजर से नहीं देखता है जो बाहर के लोग देखते हैं। उनको खुल के बोलने का मतलब उसको फ्रीडम दिया जाता है। वो बताता है कि मैं कैसे आया, क्यों फंसा हूं, क्या नुकसान हो रहा है, क्या नहीं हो रहा है, खुल के बोलते हैं। बाकी लोग भी कहानी सुनाते हैं। तो जब बाकी लोग भी कहानी सुनाते तो एक ये एहसास होता है कि अच्छा मैं अकेला नहीं हूँ। और जब उसमें से कुछ निकले हुए लोग बताते हैं तो उनको ये भी दिखता है कि अच्छा मैं भी इससे बाहर आ सकता हूँ। तो ये दोनों चीज है कि एक ग्रुप का भी एहसास होता है कि मैं अकेला नहीं हूँ और भी लोग ऐसी चीजों में हैं, और दूसरा कि निकल भी सकता हूँ क्योंकि दूसरे निकल के आए। एक कॉन्फिडेंस उनको देता है और कोई भी उंगली उठा के नहीं बोलता है कि तूने गलती की, और गलती का एहसास उसी को एनोनिमस।
एक बात और, हाँ जी सर, एक बात और बोलनी है कि अगर हम डायरेक्ट जाके किसी को ऐसे यूजिंग में हो और नशे में हो, उससे बोलेंगे कि आप इतना बर्बाद कर दिया घर वालों को, आप नशा छोड़ो, ये होगा, तो क्या वो मानेगा? मेरे ख्याल से सोसाइटी जो खुली हुई है वो सही मायने में ठीक है, क्योंकि जब पेशेंट सोसाइटी में आता है तो वहाँ उसका थोड़ा दिमाग खुलता है, वहीं आकर ये प्रोग्राम ले सकता है। अदरवाइज हम बोले तो अगले हम हमारी बात नहीं माने। ये राइट है क्या होंगे सर?
प्रवीण जी मेरे ख्याल से इतनी देर में यही हम लोग बात कर रहे थे कि अगर आप बोल के जाएंगे कि सुधर जाओ एक शब्द में तो नहीं हो।
हाँ जी सर।
इतनी देर से वही हम लोग बात कर रहे थे कि एक बार सिर्फ आके बोलेंगे, आप बोल दो कि ठीक हो जाओ, सुधर जाओ, तुम गलती कर रहे हो, तो नहीं होता। गलती कभी करता ही नहीं कोई आदमी। तो आपकी नजर में गलती है, हो सकता है कि उसकी नजर में गलती ना हो, इसीलिए इसे शुरू किया था,
सर
समझाना पड़ता है।
इसलिए सोसाइटी ठीक है, मतलब जो संस्था खुली हुई उनके लिए ठीक है, ताकि वो संस्था में आए, उसके बाद जाकर उन पर प्रोग्राम का वो असर हो, मतलब प्रोग्राम के बारे में पता लगे।
प्रवीण जी, संस्था ठीक है, मगर प्रयास ये करें कि संस्था तक पहुंचे ही नहीं। और अगर संस्था आप चला रहे हैं तो इसका मतलब ये नहीं कि हम कोशिश करें कि लोग आए ड्रग्स में और संस्था हमारा भरे। हम आप सोशल सेक्टर में कोई काम कर रहा होता है, उसका प्रयास ये रहना चाहिए कि पहला कि खुशी उसको तब मिलनी चाहिए जब वो हमारे पास ही ना आए। कहते हैं, हम लोग कहते हैं कि अगर डॉक्टर जिस दिन ये सोचने लगेगा कि मेरे हॉस्पिटल खाली हो जाए, तो समझिए कि वो डॉक्टर सही सोच रहा है, वो डॉक्टर का सही काम कर रहा है। बट आजकल के डॉक्टर जैसे सोचते हैं कि मैंने हॉस्पिटल खोला तो कितने लोग मेरे पास है, कितनी बीमारी। वैसे ही हम अगर एडिक्शन सेंटर्स चला रहे हैं तो प्रयास ये रहना चाहिए कि हमारे पास लोग ही ना, ये हमारा गोल होना चाहिए कि हम जाएं कम्युनिटी में और बताएं कि मैं चला रही हूँ संस्था और मैं देख रही हूँ कितने प्रॉब्लम्स होते हैं जो एडिक्शन में आते हैं, तो इसलिए मैं बाहर जाऊँ और वहीं से रोकूं मैं उनको। ये प्रयास होना चाहिए।
जी सर, थैंक यू सर।
क्षमा जी।
जी काफी इंटरेस्टिंग है। मुझे लग रहा था कि आपने जो 2-3 बातें कही बहुत प्रभावित भी कर रही हैं कि एक तो है कि उपदेश से हमारा प्रवचन से काम नहीं चलेगा, और इसको लेके एक चीज आ रही थी, जब हम काम करते हैं समुदाय में तो कुछ लिमिटेड ही एक्सपीरियंस है केसेस को लेके। तो आप अभी मैं जो देख रहा था कि बहुत संभावना है कि तरह तरह से जो लोग काम कर रहे हैं, आप लोग सबके निवित संपर्क में, अगर विभिन्न तरह के केसेस का की स्टोरीज अगर इस तरह से बन पाती है, तो क्या है कि गाइडेड डिस्कशन जब हम करते हैं समुदाय, तो वहाँ सबको मदद मिल सकती है कि इस तरह के केस के लेके, और उस पर चर्चा जब होती है तो कई तरह की बातें फिर निकल के आती है कि इसमें क्या हो सकता था, क्या करना चाहिए।
बिल्कुल सही कह रहे सर, बिल्कुल आप सही बता रहे हैं। तो आई थिंक
Participant, I'll request if there are no more questions, then we should wind up this session.
सर नमस्कार सर, वीरेंद्र कुमार मिश्रा जी सर। Sir, I am J.S. Anand from Andhra Pradesh, sir. I met you in several meetings at Dyke, New Delhi, sir. बहुत बहुत धन्यवाद सर, आपने IPS ऑफिसर होते भी इतना समय निकाला है सर, ये जो इश्यू को खत्म करने के लिए सर। आपने NYK और NSS को भी उनका रोल क्या है बहुत अच्छी तरह से समझा है सर। बहुत बहुत धन्यवाद, शुक्रिया सर आपको सर। रियली हम बहुत एनर्जेटिक होके वापस जा रहे हैं सर कम्युनिटी में काम करने के लिए सर। इसके लिए भी आपको बहुत बहुत धन्यवाद सर।
Thank you Anand ji, thank you for your kind words.
Now, sir, I think now we should wind off this session, sir. So before that, at the end, sir, I would like to propose a vote of thanks for sir on behalf of Director of CAPT, Sri Pawan Srivastav, IPS 1992 batch, Madhya Pradesh cadre. I would like to extend our heartfelt thanks to Dr. Virendra Kumar Mishra, IPS, for delivering an insightful talk on the role of civil society in preventing drug abuse in our recent online webinar. Your expertise and knowledge on the subject were clearly reflected in your presentation, and we appreciate the effort you took to educate us on such an important topic. Your insight and ideas were valuable, and we believe that our audience gained a lot from your talks. Your dedication to raising awareness about drug abuse and preventing it through the active involvement of civil society is inspiring, and we commend your effort in making a difference in our communities. Your presentation has given us a lot to think about, and we are grateful for the time you took to share your knowledge with us. Once again, sir, I thank you so much for your contribution to our webinar, and I hope we will have the opportunity to work with you again in future, sir. Thank you very much, sir. And for the
Thank you so much. Thank you for having me here. It was glad to be
Thank you so much. And for the person, I would like to say that if most of you have registered on our site, if you haven't, then please do it so that we will be having the records. We will having the updated record how many participants and from which place you have attended the webinar, and we can have future contacts with you also for our future endeavor. And thereafter, we will be sharing the feedback session also, that how about what are your views about this webinar and about the faculties, those who are about the speaker, those who have given the speech. And one thing I would like to say that this presentation and this webinar is live available on YouTube also. It will be a recorded version hereafter. And lastly, the present PowerPoint presentation, share Dr. Krishna Kumar. He will share with me the presentation he has taken. Then definitely I am going to share that presentation on the WhatsApp group. And further, one more important thing I would like to say that we in our academy, in Central Police of Academy, we conduct National Conference on Drug Law Enforcement. It's a yearly conference we are doing so. It's a 2-day national conference, and this year it is proposed in the month of October or in the September 2023. So you being a very experienced person, I would like to have ideas from you about the topics which we can discuss at this platform. I would like to say at this platform, most of the senior officers of drug law enforcement, IPS officer, those who are at the helm of this affair, they are joining this webinar, and we find out some very amicable solution and recommendation for the forwarding it to the Ministry of Home Affairs for further future improvement. And lastly, for the participant, I would like to say thanks to all of you. Thanks to the esteemed participant whose presence and active participation in the discussion have made this event a great success. I want to thank each of you participants for your enthusiastic engagement and contribution to the discussion. Your question and comment have added value to the conversation and helped us to better understand the challenges and opportunity in combating drug abuse and addiction. Thank you very much to you all, and we look forward to your engagement in our effort to build stronger community and create a brighter future for generation to come. Thank you very much to all of you. Now here we wind off and we close this webinar. Thank you very much.
Thank you.
Thank you, sir, for
Be
your
connected in our WhatsApp group. Don't leave that WhatsApp group.
and
Thank you, sir.
information.
Thank you, sir.
Thank you, sir.
Thank
Very
you,
thankful
sir.
to you.
Thank you, sir.